Sandra all the time is here with the cold hard truth. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama. Call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra. And
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth-telling, more problem-solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. right. Good morning, everyone. Happy Tuesday. We are so happy to be here today. And of course, we have a lot to talk about. OMG. If you guys were tuned in last night, you know exactly what I'm talking about. So please stay tuned for that. That was a wild one. Even I must admit that it was super interesting. And we're going to dissect some of that into the program today. But of course, it is Medical Rundown Tuesdays with none other than our good friends over at Health City Cayman Islands. And this week, we're going to be talking about World Health Day. So, this is a very, very important annual event. And it really is celebrated annually around the world on April the 7th. And it's marked by the founding of the World Health Organization way back when. So the theme for 2025 is healthy beginnings, hopeful futures, and it's an emphasis really on the importance of maternal and newborn health, a very, very important area. So we've got two physicians who are going to be joining us today. First of all, we have Dr. Mohini, who is a consultant obstetrician, obstetrics and gynecologist. So, Dr. Mohini, good morning to you and welcome to CAM. How are you? Just unmute yourself for me and we are good to go.
Yeah, good morning, Sandy. How are you?
Good morning. I'm good. How are you?
I'm good.
I think this is your first time on the program.
That's correct.
Yes. Well, welcome. Welcome. We love to have first timers here. I know it won't be your last time for sure. So you're part of the team. Tell us a little bit, Dr. Mohini. I'm not even going to try the last name. Well, let me try it. Is it Sakdeva?
Sachdeva. Yeah, that's correct.
Sachdeva. Yeah. Okay. So I know you're part of the team now that Health City Camana Bay location has a full maternity ward, NICU. I'm assuming that you're part of that team with the obstetricians and gynecologists. We have several physicians, midwives, and the whole 9 yards to really have a full complement of experts available to help prenatal, during the delivery and birthing process, and of course, postnatal care as well. So give us a little rundown on who you are and what your credentials are.
Okay, so I am Dr. Mohini Sachdeva. I work as a consultant, obstetrics and gynecology at Health City. I have worked before in India. I have 7 years of experience in total. I graduated from Medical College in Delhi, and it was a very busy hospital there, up to 26,000 deliveries in a year.
Wow.
Yeah.
Yeah. That's a lot of babies.
That's a lot of babies. So I joined Health City early this year, and our department consists of 3 consultants. So we have Dr. Indu and Dr. Mamata, and we have a great outpatient department. It runs every day except Sundays. We are there 24/7 for emergency calls entire day, and we have a level 3 NICU that is headed by Dr. Anil, who's also here today to take care of the newborns and the mothers.
Yes, fantastic. We've had Dr. Anil here in the program before, so
Yeah.
let's go ahead and welcome Dr. Anil in, and he's also given us a personal tour of the maternity ward and the
Hi.
NICU. Good
Hi,
morning.
everyone. Hi, Sandra. Hi,
Hi,
Moin.
Dr. Anil. So good to have you here, and he is a neonatologist and pediatrics. Those are his specialties. So it's so good to see you again, Dr. Anil.
Thank you. Thank you for welcoming me on this important day, Sandra.
Yes, absolutely. So how are things, before we get into the details of World Health Day this year, how are things going at the maternity and NICU unit?
So we are so excited that the maternity and the neonatal unit has started, and we have finished with few deliveries, and even we had a NICU admission, and the baby is also discharged, and that's a good news for all of us. And everyone is so happy, and the atmosphere is brilliant, electrifying.
Yes.
We are just waiting to save some more babies and impact some more lives.
Absolutely. I'm just going to see how I can, hold on, just making some little adjustments here. So tell us a little bit about how many babies have you delivered since the maternity ward has been open?
So we have had 5 babies up till now.
Mm-hmm.
Have
Very
delivered
nice.
in Health City. Yeah.
Yeah, awesome. All right, good. Is it still the trend? Because when I had my daughter 8 years ago, girls were outpacing boys, probably maybe 2 to 1. Is that still the trend?
Yes, yes, yes. This three and two now.
Yeah. So we still have more
The
girls.
girls are
Yes.
the girls are winning the race. Hopefully, we'll catch up soon.
Oh, fantastic. Well, thank you so much to both of you. And I know that this is a much welcome addition, of services that you have at the Health City location, because again, there's so many expecting moms and, families that really do need those services, and to have a world-class NICU and maternity ward. Now, you just mentioned, Dr. Mohini, that it's just tell me the rating again of the facility here and exactly what that means. Perhaps Dr. Anil can fill us in as well. So I think you said level
3
3.
NICU. Yeah.
Yes.
So I
What
think
does that
Dr.
mean?
Anil can elaborate more on that.
So level 1 is a basic facility wherein we just monitor the babies. We don't do any interventions much for them. We just can be with the mother. It's almost as similar to be with any other routine ward. That's the level 1 NICU, wherein we may give some IV injections for any sepsis the baby has caught from the mother or from the environment. After discharge, also they may come back. It's almost as similar to a ward. They may be monitored just for sugar controls. They may be monitored just for temperature maintenance. They may be just monitored for any other like weight giving care, kangaroo mother care. So these are just comes in level 1 NICU. So level 2 NICU is slightly higher level of care, wherein you take a mild breathing problem babies who can be managed with a smaller equipment like CPAP and other things like oxygen by prongs, just prongs. We don't really take much sicker babies in a level 2 one. So in a level 3 and beyond level 3 NICU, we have all these sicker neonates who have like very bad lungs, who have heart issues, who are put on ventilators, who have continuously seizures going on, and with multiple infections, rapidly spreading sepsis, and many other like abdominal problems, who have a GI bleeding or GI infections, who need a very high level of monitoring with around like 2:1 nurses per baby, like 2 nurses looking around or taking care all around the time for the babies, and doctor round the clock present to even pick up even the minor of the minor abnormalities they have. So in Health City, we usually have 2 nurses deployed for each babies. They'll be around the baby looking after everything, every single parameter, the changes in the baby each minute. We have wonderful nurses to care for these babies. That's what happens in level 3 and level beyond that NICU.
Right. Wow. So, this is fantastic because, again, as someone who has, had I wouldn't say that it's unfortunate, because it certainly is an experience, and it wasn't the worst case experience, but having had experience with a NICU unit, and, I want to give accolades to say that it was good to have a baby that didn't have any severe difficulties. So she was able to stay on island, but it is very, very refreshing to know that you have the facility here. If more serious intervention is needed, that mothers and families really can avail themselves of those options. So let's talk about World Health Day. So this is a very, very important one. And the theme this year, super interesting, says healthy beginnings, hopeful futures, which is an emphasis on the importance of maternal and newborn health. So, we start this world at that stage, right? So getting a very, very important start in life with mothers and babies being healthy is so critically important. In fact, just last week, there was a very shocking case of I think she was 33-year-old American, and she was a nurse, and she did a lot of like maternity and nursing style videos. And unfortunately, she had, I believe, her first child, and she passed away during the birthing process. And it's just a stark reminder of how that time of your life for women is very, very precarious. It is actually one of the most dangerous times of your entire life. And so what advice do you give? She was actually on Instagram. She had a huge Instagram following, only 33 years old, had almost 500,000 followers on Instagram, from Southern California. And it's complications happen. So she had a rare complication after giving birth to her son, but it's just a stark reminder that you can be young, you can be healthy, and things can still happen and things can still go wrong. So, it's just great to have professionals on island, the medical expertise that you need, the support staff, the midwives and everything, to really just help you transition through this extremely important period for both the mother and the baby.
Yeah, so that is so maternal mortality is a grave issue, and after so many years, the World Health Organization has actually made maternal health the theme this year. So technically, maternal mortality is death of a woman while pregnant or within 42 days of delivery due to any complications arising from or aggravated by pregnancy. And as much as we like to deny it, it is the reality. And there are many countries, especially the developing ones or the underdeveloped ones, that have a very high maternal mortality ratio. It is one of the key health performance indicators for any country. And although it is very low in US, I think it is in double digits, it's around 21, but that's still higher than other countries who have, like Canada or UK, who are in like single digits, like 7 or 6 or 9. So it is a very important issue, and awareness is the first step in this. How you must be aware of what to do when you're pregnant, no matter how well booked you are, things can still go wrong. That is why it is important to have hospitals with ICU beds and multi-speciality teams, and even for the babies to have NICUs available to take care of those incidents.
Yeah. So, this World Health Day really focused around the importance of maternal and newborn health. But of course, that also includes mothers, because, if a mother isn't healthy, she can't provide adequate care for a newborn, and having the support system around her being extremely important as well. So, folks, newborn health focuses on the care of infants in the first 28 days of life, which is the most critical stage for survival and development. And ensuring the health of mothers and newborns is fundamental to the overall health of societies and future generations. And of course, mental health, things like postpartum depression, also something that has to be taken into consideration. So someone was asking, and I don't know if you have this information, but someone was asking, what does the current local birth rate look like? Do we have any ideas how Cayman is doing in terms of birth rate?
So to round off, I think it would be approximately 1,000 births in a year.
Okay. All right. And I don't know how that compares regionally or around the world. It's probably not the highest for sure. But, holding steady, I suppose. So what are some of the things around this World Health Day theme that, mothers should be looking at? We're going to look at some of the current challenges around maternal and newborn care. So globally, approximately 300,000 women die annually due to pregnancy or childbirth complications, according to the World Health Organization, and over 2 million newborns die within their first month of life each year. Now, do we still have, I know, years ago, we heard a lot about SIDS. When I was, pregnant with my daughter, it was like, okay, you got to even things in the crib, like don't put excessive, people love to put like the bumpers and all sorts of things in with a baby. And they tell you the advice that I was getting, reading online and so forth, is basically don't do any of those things. Like don't put a baby in a crib with bumpers, with excessive, toys or blankets and all this kind of stuff. Yeah. So is that still good recommendations?
Yeah. We don't recommend too many things in the crib. If we are able to monitor the baby surveillance, the baby 24/7 with those things around, then it can be a better thing. Today we have all the sophisticated things, like you can have a camera fixed onto your crib with notification sending to you when the baby moves, when the baby cries, and you have an Apple devices, watches that can also give you a notification when the baby moves or gets up, cries for the feed, even if you are in the other room or even in your kitchen. So these are some of the gadgets we can use when you put a baby on the crib nowadays. So all these things usually take a setback nowadays. Like, they may be an age-old concept, but still, to some extent, we don't really recommend you to stuff so many things, because they may accidentally, suppose you have a soft toy in one corner of the crib, that may accidentally topple on the baby, and then the baby will not be able to even have a strength to move it away. Some of the bigger soft toys, big things you get as a gift when the baby is born, they may be choking for the baby as well. So we don't recommend to stuff too many things, but in the same meantime, if you can afford, use these gadgets to monitor your newborn when you put the babies on crib and you're away from the crib.
Yes. Some good advice there. And of course, one of the concerns too, you mentioned how, we don't think about a newborn. They can't turn over yet. There's a lot that they can't do in the first 28 days. So they're very, very limited in how they're able to help themselves. Sometimes, they can't even properly cry out for help. So you've got to be as cautious as you can be. So the advice in terms of keeping babies, for example, at the right temperature, I know here we live in the Caribbean, is it just to layer clothing? Is that the best way, instead of blankets and that sort of thing, is to just put them in a onesie that maybe is long sleeve and so forth?
Yeah, what we advise is usually you can have one additional layer than what you have for the baby. So suppose you're wearing one layer, we have an additional layer for the baby. A clothing plus a blanket, that becomes an additional layer. Suppose the baby is born premature, we tell them to have 2 additional layers than what you are having. That will maintain their adequate temperature. That's the thumb rule. Like preterm, 2 additional layers, and it's a term baby, 1 additional layer than what you have. That will serve their temperature maintenance.
Yes, because preemies in particular, one of the issues with babies is their ability to regulate their own temperature. So that's why when you go into the NICU, that's one of the things that they're definitely closely monitoring. Sometimes you'll see them even with a heat light on the baby, because they're very, very cognizant of the fact that babies can't really regulate their own temperature yet. So you've got to assist them in that way.
Yeah. The pictures you see, you're shown here, like 3 million women dying and 2 million newborn babies. They're like very alarming, and most of these deaths are preventable. That's why the WHO. I congratulate WHO to take up this theme this year on maternal and newborn care. And more than 50 to 60% of these numbers are totally preventable by accessibility to the right care at the right time across the globe.
Yeah. I mean, it's so amazing, Dr. Mohini, when you were talking about the U.S. having double-digit, mortality rates for mothers, because we think of the U.S., for example, as such a first world country, but when it comes to this area, they are really, really, showing some devastating numbers. And in particular, we should say for minority mothers, so African American women, Asian women, have a much higher risk factor than others, things like preeclampsia and also just access, as Dr. Anil said. A lot of time it comes down to access to quality healthcare. And that's such a concern for a country that is supposed to be a first world country. And I think here in the Cayman Islands, that is why I think it's amazing that we have world-class facilities like Health City offering their services in the maternity and NICU unit, because, just because you're first world doesn't mean that you may not have some severe gaps in your medical delivery services that result in double-digit mortality rates. So challenges also including limited access to care, inadequate healthcare infrastructure, and socioeconomic barriers, which, really means that a lot of times you just can't afford the healthcare that might be there. And if you can't afford it, then it almost, is useless to you in a sense. So preventable, Dr. Anil, 50% of this, you say worldwide, could be preventable if they actually had access to quality healthcare. That to me is just so incredibly shocking.
Yes.
Yeah. All right. So let's look at how we can improve some of the strategies to improve healthcare outcomes. Obviously, the first one is access to quality care. So ensuring that all women have access to skilled healthcare professionals during their pregnancy and childbirth. Dr. Anil and Dr. Mohini, what are some of the things that when it comes to quality care that you think are most important for expectant mothers? What are some of the things that you're watching when they come in?
Ideally, if a mother is coming for booking, we would like to see them as early in their pregnancy as possible, because there are certain, so there are two parts to it. One is the mother's health, that we do some baseline testing of the blood tests to find out if they have any underlying conditions, so that they can be optimized before they deliver, so that it doesn't cause any complications during or immediately after delivery. The second aspect is monitoring the baby's growth in the uterus, in the womb, during the pregnancy. So the second aspect of it is to first of all rule out any abnormalities in the baby. If there are any, we can prepare accordingly at the time of the birth. If the baby requires any surgery or any intensive care unit support, we can prepare accordingly. So we have to monitor the growth of the baby throughout the pregnancy and the mother's status, because sometimes the mothers, especially Asian and Caribbean women, are more prone to develop gestational diabetes or high blood pressure in pregnancy. So, optimizing each complication as it comes, so that there is no problem during or immediately after delivery.
Yes. And because those things, as you say, can lead to some real concerns a bit later on, preeclampsia being one of the...
Not just during the pregnancy. So in the developed world, that is the Western Hemisphere, most of the maternal deaths are due to indirect causes. So indirect causes include, maybe they had includes like heart problems or any neurological problems that they already had. So it is a pre-existing condition that is worsened during pregnancy. So if you're planning a pregnancy, it is good to meet your obstetrician before you plan a pregnancy, just to get a hold on these conditions, and so that they're optimized by their respective specialties, cardiology, neurology, before you get pregnant. It's very important for safe motherhood.
Yes. And what is so interesting, Dr. Anil, is sometimes we have a problem and we don't know it until a pregnancy, and then you go in for a checkup and it's like, oh wow, you have this additional strain in your body. Let's see why your body is responding in this particular way, and then you find out that there actually is something else going on.
Yeah, some of these things can complicate pregnancies. Some of the autoimmune diseases, some of the infections, these diabetes, they can be unsurfaced by when the woman becomes pregnant, and they directly or indirectly affect the baby's health as well. So that is very apt for today's theme, like healthy beginnings and hopeful future. It's not, as a neonatologist, I may advocate that from the neonatal age the future begins. It's not the neonatal age, it's even before this, like the time of conception. From the time of conception, if we have a right health, if we create a rightful environment for the developing fetus, developing neonate, that's what it leads to a better future in the coming years. And that's what depends on how well the child can behave or function in a society in the upcoming life. And that is very important. These foundations are laid down even in the earlier times. Okay, and that is what it means. We have to invest our proper infrastructure into the well-being of these mothers than anywhere else.
Very interesting. Thank you so much for that. So nutrition, let's do education and awareness, of course. The more you know about your own health and family history being extremely important. I remember just to share a little nugget of my personal experience, when we sort of discovered early on in my pregnancy that my baby was growing small, we had two concerns. Number one, we were in the height of the Zika situation. And I want to ask you about that in just a second here. So it was like, oh my God, have you traveled? Did you get bitten by any mosquitoes? I'm like, well, everybody gets bitten by mosquitoes, right? Sometimes you don't even know it. But I actually went to the University of Miami's facility because they had a specialist there who was a neonatologist, but he did more stuff on the genetic side. So they were trying to figure out if there was any genetic predispositions to low birth weight or low growth. And I just didn't even know enough about family history to be able to answer some of the questions that they were asking. So, expectant moms, or even before you get pregnant, maybe it's a good time to sit down and have a conversation. Talk to, if you've got older siblings who've had babies, your mom, grandmothers, if they're still around, get some family history from them. Like, what was it like during your pregnancy? Did you have any complications? Do we have premature births in our family? Because that can then help you when your physician starts to ask those questions to provide that information to them. And there were just so many gaps in what I knew. I was like, oh, I don't know, and so, doing effective sort of family history is really, really important for physicians to be able to consider whether or not there might be something else going on that they need to have a look at.
Yeah, I totally understand your condition. Like whenever there is a serial growth abnormality in a baby in the scans, we call it as an IUG, or intrauterine growth restriction. We tell them, we classify them for 4 causes. One thing, it can be a fetal cause, genetic, like inherent genetic potential of the baby to grow less. And next thing is maternal cause. Any mother has any conditions like renal disease or cardiac disease. She has any problems, anemia, low blood. So these are some of the conditions that may affect the growth of the baby. And third thing is any placental cause. When the placenta, which functions as a barrier from mother to baby or to transfer nutrients, that has any problem. And the fourth thing is the environmental cause, the outside environment, like tobacco, smoking, drugs. And then third one is the infection, the Zika virus infection. That is the environment. This comes under the environmental influence of decreasing the growth of the baby. And I'm very sure that they have evaluated you for each and every thing you might have possibly had because of this restricted growth in the baby. Yes, and that's why they asked you about the Zika virus during.
Yes. So let's talk a little bit about Zika. We haven't heard much about it. I know that the babies that obviously were impacted by that, some of them are still alive and they're still struggling. What has happened to the Zika virus? It's like it came and then it kind of disappeared.
We cannot call it as like it disappeared. It is there, and it is there endemic. In these Southern American or the Central American countries, even before from 1940s, 50s, it is present there. So it has come into the light recently because we have improved on the diagnostic techniques and our suspicion has improved and accessibility to healthcare has improved a lot. So we have been having these babies who are born with small heads, who have been like very growth restricted, and they have never survived because of no NICU facilities during that time, no diagnostic facilities, no advanced RNA or DNA PCR techniques during that time. That's when this whole disease was like hidden for 4 or 5 decades, and suddenly the technology has improved and suddenly more diagnosis has come up. And once in a while, when there is a clustering of cases, there will be spike of these cases. There will be any festival going on, any carnivals going on in Brazil or somewhere when a lot of tourists go and come back, and they go back to their home countries. That's when there will be a spike of cases in some of the regions in the world. That's when Zika comes into the news, and rest of the time it stays hidden in these endemic countries.
Yes. And you know what I was really quite surprised by, maybe some young people, if they're trying to get pregnant, might want to think about this. Zika can actually pass sexually as well. So it's almost like it can be transmitted from a man to woman. Yes. So something to really keep in the back of your mind, folks.
Yeah, we don't just ask for the maternal travel history in the Zika. We also have to ask the history of a man's travel. The partner's travel during these last 6 months to 1 year. It may stay hidden in the man's body, and even in the sperm. It can travel from sperm to the egg and then to the ovum and zygote as well. So both travel history is very important.
Wow. So fascinating. It's just like you said, it spiked and then it looks like it disappeared. I'm like, why haven't we heard any more? So are those Zika babies, poor little things? I was so shocked to see what they were suffering from. What is the longevity of their life? I mean, obviously the quality looked like it was going to be very, very complicated. Things like GBS, which is the Guillain-Barré syndrome, severely affecting the brain. Poor things. Are they still surviving? What's the survival like for them?
So, like, it depends on how much the effect on the brain is. If there are vital regions of the brain are affected, the brain is not functional at all. It may be most of them they die in first decade only. They don't make it beyond first decade. It severely hampers the growth of these brain of these neonates, and the brain has a severe cognitive dysfunction. They'll not be able to swallow. They'll not be able to, vision, hearing, everything is impaired, and it's totally not treatable. There's no cure for this Zika viral infection. You just have to give them a palliative care until these babies are, and it adds terrible stress on the parents, family, and there's a huge economic burden we face with them.
Yeah. Oh my gosh, so sad. Well, I'm glad that we're not, having a flare up of it, certainly at the moment. So nutrition also being very, very critical, promoting proper nutrition for mothers and infants to support healthy development. Are you guys going to be offering any prenatal classes, Dr. Anil, at Health City?
Yes.
Yeah, Dr. Mohini can elaborate on this week.
Yes, so we have prenatal classes available for mothers, and it's not restricted to mothers who are booked with us or who we are seeing in our outpatient departments. It's open for everyone, actually. And we have a schedule of classes. It's like a rolling schedule. If you miss the earlier birthing classes, you can join in any time, and it goes on in a cycle, so you can cover up all your topics. It's open for everyone, and one can reach out to us for information further on that. We have a good team of 2 midwives who are conducting these classes in collaboration with the pediatrics department and the obstetrics department.
Mm-hmm. Very good.
And yes, most importantly, when they come for an antenatal visit, we do take them through a tour to our postnatal wards and even to the NICU, and just to make them feel comfortable, so that where their baby will be cared for, they'll be assured that seeing the infrastructure and seeing the equipments and the kind of care we get here, they'll be assured that they're going to have a safe birthing on the island.
Mm-hmm. Yes, that's very, very important, because I know a big part of the prenatal courses is proper nutrition for mom, and the things that she should be, monitoring in terms of her diet, getting adequate exercise and so forth as well. So someone just mentioned that one of the partnerships is with Ariel from the Mom Method, where they do prenatal Pilates at all different intervals. And these are available at the Camana Bay location. So very, very good. All right. Immunizations. We see in the United States of America, there's a big fight around vaccinations and immunizations at the moment, and they're having a measles outbreak. I think just yesterday, a second child has died from measles infection. And now their political administration, which was sort of anti-vaccines, seems to be having a change of heart. And now Mr. Kennedy, who's head of that area, is saying, oh, let's all run out and make sure your kids are vaccinated against measles. But immunizations have saved lives around the world for babies and children into the millions. And so it's very, very important for babies to get prenatal testing and all of their required immunizations to protect them from life-threatening diseases. So how early do babies get immunized, and what are some of the early immunizations that they receive?
Yeah, the immunizations have been a wonderful invention that has saved the mankind, and it's very unfortunate that's why so many people are still not understanding what we have a live example of COVID. If we have survived this COVID wave, it's because of the vaccinations we have had. Leaving all the masking up or the distancing or staying at home, quarantining, everything, but the vaccine has saved the planet, I feel. And then with this coming up of measles, it's mainly because the immunity of the society has come down, because last 2-3 years after COVID, it has happened. So many people have not attended the vaccination clinics, where they have missed the vaccination. And when a certain percentage of the society, children, are unvaccinated, that's when the infection breaks up. You have one child who travels from outside a country, who is unvaccinated, who carries an infection, comes into the society which has no immunization or no immunity, that's when the disease spikes up. You may not have disease on the country. Somebody from the outside country, they may travel with an infection hidden in them. So and the children in your country are prone for this infection because you're not vaccinated, and that's when they can catch this infection. And sometimes with the poor immunity or underlying heart disease, these are the children who are going to bear the brunt of these preventable diseases. And the first immunization, currently we are following the NHS protocol or the UK protocol for vaccination that has been recently updated. In this, we are not following the hepatitis Hep B at birth. So we are directly, the immunization starts at 8 weeks of age. So directly at 8 weeks of birth is when the first immunization is being given, which has like diphtheria, pertussis, and tetanus injection, and then a polio, and then Hep B is given. Okay, and then these are some of the pneumococcal. Most importantly, is the pneumococcal vaccine that has been made, and the same thing is given at 2 months, 4 months, and 6 months, and then it is next at the 1 year wherein you will get meningococcal vaccines, and then measles as well. So up to 6 months to 1 year, if the mother's immunity is good, if the mother has all the immunoglobulins and her immunity is good, the immunity is passively transmitted in the baby, and it's somewhat like protects the children, like not 100% protection, somewhat, and it wanes off by 3 months to 1 year. The immunity that is transferred from the mother wanes off, and the child has to build up his own immunity, and that's how these vaccines help in building up the immunity of these kids. And so I advise all the parents on the island, don't miss any vaccine for any reasons.
Yeah, and
Very good.
not just the vaccination of the children, it's also the mother, the pregnant lady who comes to us. There are certain vaccines that can be given in pregnancy that stimulates an antibody response, an immune response, and that immunity is transferred to the baby via the mother's blood. So flu vaccine during the pregnancy, vaccination for tetanus, acellular pertussis, that is whooping cough, and diphtheria in pregnancy can actually help protect the baby for the first 6 months of the life, till the baby's vaccination protocol kicks in.
And I mean, there's certain things that mothers obviously can pass on, but also even fathers, we know that they can pass on certain things as well. So, it's really an opportunity to make sure the entire family is as healthy as possible.
Yeah, we call it as a ring immunization. Like if wherever the child stays, the ring around is the family members. If the family members are all vaccinated against the common diseases, the vaccine preventable diseases, you create an immune ring around the child. So usually before 6 months or 1 year, the child is not into the society. And in the society, we call it as the terminology is called the herd immunity. If the herd is immunized, immune to certain diseases, the disease will not enter into the herd. When the herd immunity falls because of no vaccination protocol, that's when your herd is prone for the infection. That's what's happening with the measles in America.
Well, very good. I know our audience members are listening to this very, very interesting segment here today. Family planning, so offering resources and education and family planning to promote spacing and timing of pregnancies. This is so important. I've heard of so many cases, Dr. Anil, where women feel pressured after they've given birth to do it again, like right away. What do they call them? There's a term, something twins.
Irish twins.
Irish twins, yes. where the babies are so close together that basically you're getting pregnant within like the first 8 weeks, which you're supposed to wait. So, the body goes through a lot, and, there were so many things, I know a lot about a lot of different things, but I must tell you that postpartum, there were things that were going on with my body. I'm like, wow, this is what happens after pregnancy. I honestly had no idea. And that's why, you want to be able to sit down with your physicians and do the classes and research as much as possible, because, what you don't know can hurt you. And it's good to know what happens to the body, before, during, and after pregnancy. But why is it important for women to space out babies, to take time between pregnancies as well?
So, in taking time between pregnancy is very important, because pregnancy, delivery, and caring for a newborn is probably the toughest phase of any woman's life. It
Mm-hmm.
takes a toll on you, not just physically but mentally as well.
Mm-hmm.
1 in 5 women develop anxiety, postpartum blues, postpartum depression, uh, partly because there's a very sudden change in your life. Also, there's a sudden crash of hormones that makes you more prone. And on or while you're dealing with all of that physically, mentally, you have to care for a newborn, and you're up all night feeding the baby, taking care of the baby. So for that, mostly for letting your body heal and recover from the delivery process, so at least 6 months gap should be maintained before you start trying for another baby.
Mm-hmm.
Also, when you're exclusively breastfeeding your baby, it acts like a natural contraceptive. So that's the nature's mechanism to not to give your body some rest and not let you conceive. There are an array of contraceptive options available that one can use immediately after delivery, ranging from hormonal methods that you need to take a tablet every day, to a monthly or a 3 monthly injection, or more longer acting methods like getting a copper coil inside the womb that can protect you from another pregnancy from 5 to 10 years, depending on how much you want to space your kids.
Mm-hmm. Mm-hmm. Very good. And it has to obviously be a family decision, but I always say to women, don't allow men to pressure you or anybody else in the family to pressure you that quickly. In my situation, because I was an older mom, the doctor at the time said to me, well, if you're going to have another one, now is the best time to do it because you don't have any time to waste. And I decided not to do that because, again, because she was a preemie and there were, I was like, very stressed out. So I said, maybe it's one and done for me. And I'll just be happy to have one healthy baby and not really try to push the envelope. So you've got to make decisions in life and really, really think about these things. So Hull City, Cayman Islands has amazing resources and support. We talked about some of the prenatal classes already. They've got prenatal consultations, childbirth services, postnatal care, and of course the NICU fully operational, and community outreach programs to educate and support expecting mothers. So one of the things that you often feel as a new mom is a degree of isolation. So many people have given babies. It's amazing that you could feel isolated, but it's good to have a network of other new moms that you can go out and socialize with. You can take the baby out and get some fresh air. I know that Caribbean people are perhaps, a bit more conservative when it comes to babies. Like I am very, especially the first month or two, exposing them to like germs in the world out there. Caribbean people, they have a philosophy like you stay home with the baby, but that can also be very isolating
For the
for
mother.
a new mom.
Absolutely.
Yeah,
So
that is an age-old thought, Sandy. That has to be overcome. We don't advise. We advise just to avoid exposure to someone who has an infection. If there's no infection, there's nothing. Cayman air is so fresh, so good, and so nice. The baby has to feel the air, fresh air outside.
Yeah. So get out with the baby, go for walks.
Yes.
Go with the stroller and walk around. Cayman Bay is a lovely community to do some walking. And speaking of infections, one of my pet peeves are people who love to come and touch a newborn and touch babies. I am like so annoyed when I see people do that. And we've seen babies get infections. There's one child, again, this was in the news recently, who is going to lose an eye potentially because someone with the, I think it's HPV virus, went and kissed the baby or something, and the baby actually got the virus in the eye. So folks, there's no need for people, I think, outside of the immediate family, especially, to be in a baby's face, kissing a baby and touching a baby. I don't kiss babies on the lips or the face, or even my own baby. I'm like, nope, don't kiss a baby on the lip. That's not necessary. Give them lots of hugs and cuddles. But overly kissing them and stuff, to me, is just absolutely unnecessary, and it puts them at potential medical risk as well.
Yeah, absolutely. Even not just humans, even the pets, you just have to avoid them. Yeah, the secretions, the virus can travel through the secretions, the salivary secretions, and any bodily secretions. You just avoid both the humans and the pets, cats and dogs.
Yes. Yep. Keep your newborns away from. I know we want our pets to get used to babies, but do it from a respectful distance, and yeah, they're less likely to get injured and stuff as well. Well, this has been a very good discussion. World Health Day was celebrated around the world yesterday, folks. World Health Organization. I think that these are just good points for us to remember. Health City, Cayman Islands is always on the forefront of ensuring that we know as much as possible about our health, our family's health and well-being, and they continue to expand their services and bring in experts to the team like Dr. Mahini. Dr. Anil now has been here offering his neonatology and pediatrics services. So thank you both so much. Really appreciate it.
Thank you. Thank you, Sandy.
And of course, let me just remind people of the contact information for Health City. 640-4040 is the telephone number, and it's info@healthcity.ky is their email address. And they have a really cool Health City Connect app where you can have all of your information in one central location, and you can also book appointments with the specialists and so on. So thanks, guys. Have a fantastic day.
Thank you. Have a nice
day. Thank you so much, Sandy.
Thank you very, very much. Now, you guys might remember, I want to address this because I was just reminded with the team that was here. Last week that we had that grandmother call in? She had her grandson and he was having what she thought was an asthma attack, and she wanted to get to the hospital, and there was some sort of confusion about what was going on. And she said that she called and she didn't know that she had to go to Cayman Bay, and they told her yes, it was East End. So we did reach out to the Health City Cayman Islands team immediately. In fact, let me just pull up my little messaging here, and we wanted to know what had happened, what had gone wrong. And so I'm pleased to say that Dr. Benoit, he's always on top of things. I know he always appreciates when I send him, consumer feedback and commentary. And he said, thanks for bringing this to my attention. I inquired thoroughly, and the call was taken. Because remember, there was a question of, the calls are being routed to India. And I'm thinking, why on earth would we be routing calls all the way to India? That kind of didn't make any sense. So I wasn't sure about that. And he said, no. He said he inquired thoroughly. The call was actually taken by the manager in duty at the Cayman Bay Hospital. It's not a call center. So I think that was important to clarify, because some of you are like, yeah, it's a call center. It's not a call center. And apparently she did not specify which location to bring the child. So this comes down now to communication, right? So she's the manager in duty at Cayman Bay Hospital. So when she's like, yes, bring the child to us, not thinking this person on the other line might be thinking East End, right? So a little miscommunication there. So she did not specify the location, which location to bring the child. She assumed the mother was bringing the child to Health City, Cayman Bay. And he went on to say that we're educating all of our staff who are patient facing to specify the location when they communicate. So again, they've only recently opened up the second location, but it's important to specify where you are. And we will address this issue with all the means so that this will not happen again. And thank you for bringing this to our attention. So, things happen, miscommunications happen, and we're always happy to give them the necessary feedback in order to make your patient experience that much better, and to again make it more forward, just excellent customer service. Forward facing people need to know certain things. So this past week I want to do a big shout out to our friend here, Ryan Haylock. Ryan had posted a situation, and some of you may have seen it and commented about it. And so he was talking about taking advantage of the colonoscopy special for $2,000. And he said that there was this is what he posted on social media. And he did make a public post. So this is why I'm, sharing this with you guys, because again, I reached out to the Health City team on Ryan's behalf when I saw the post and said, hey, what happened here? And we've gotten some clarification. So communication, folks, is so important in all aspects of our lives. And because I know that a number of you actually saw this, you might not know what the follow-up was. So I think it's important to let you know that anytime, certainly, that I bring something to Health City's attention, they are very, very keen to follow up with it. And, that's the best way to get results. So Ryan posted this on his Facebook page, and he shared this experience. He said a local healthcare provider advertised an offer of US $2,000 to do a colonoscopy. There was no financial or other conditions listed. He goes on to say, I called and I agreed to it. They said they would check if my insurance provider covered it. They did, and sent me a payment link, and a few days later to pay US $610 without any explanation of what it was for. Needless to say, I was confused. So I called them and was eventually told that the insurance only covered 80% of the amount. Okay, 80% of 2,000 is supposed to be 1,600. So my payment would be 400, right? Wrong. So apparently, because my insurance provider covers the procedure, they're charging the full price. So this isn't actually correct, but I'll get to that in a second, of US dollars 3,050 rather than the US dollars 2,000 offer without letting me know. Talk about false advertising. Wow, is this what healthcare providers do when one has insurance? No wonder medical costs are sky high. They know they will eventually get paid from insurers. Has anyone else encountered the same problem in the last month? So of course, he didn't have to say who this was, because we know that Health City Cayman Islands were the only ones who were actually offering this colonoscopy special. And so again, I sent that to Dr. Benoit, Shamari, and their team, and they came back with a full explanation of what had actually transpired. And I know that they had Ms. Rebecca Brooks over there at Health City Cayman Islands reach out to Ryan to fully explain precisely what had happened. So here's the explanation. And it had nothing to do with them trying to pull a fast one as it relates to insurance. And because you have insurance coverage, you're going to be paying more. That's not what this was at all. Apparently, this is the explanation. So again, Dr. Benoit says, I took some time to get the complete story about this. And the reason for that's the reason for my delayed response. Let me explain in detail. A colonoscopy typically falls under one of three categories: screening, diagnostic, and therapeutic, depending on the indication. So this is where, health insurance gets a little bit more complicated sometimes than okay? He goes on to say, depending on the indication, most of the time it falls under screening or diagnostic. A diagnostic colonoscopy is covered by insurance with a 20% copay. The shift rate for this procedure is $3,050, meaning that the patient's copay would be $610. A screening colonoscopy falls under the wellness benefit, but most insurance plans cover only $600 annually for this. Many people on the island fall into this category and cannot afford the $3,050 cost, which is why we offer a highly discounted price of $2,000 for screening colonoscopies. Otherwise, they'd have to pay the full $3,050. I can say with pride that we're the only private facility on the island that does not charge a single dollar more than the shift rate for any procedure. Thank you, Health City. Now, regarding this particular patient, he's eligible for diagnostic colonoscopy, which has been approved by his insurer. And so that's why his copay would be $610. Our staff informed him of the two options. Number one, going through insurance and paying $610, or number two, choosing the promotional charge of $2,000. And again, they have call recordings between the staff, and in this case, he dealt with Caymanian staff, and they can pull that up. They have various phone calls, emails, communications, and the two options were explained along with the copay. And so due to privacy policy, obviously, they can't share any of that information. But again, sometimes these things get a little bit tricky. And so it's hard to understand. So, ask questions. And, again, there could be differences between the types of services that are being offered, and what is actually being offered is the diagnostic one. And so, again, going forward, I'm sure Health City will clarify that in their promotions, put a little note that this special is for the diagnostic or screening colonoscopy, because if you need, and it's possible that you might need the diagnostic one, you're going to be paying a little bit more, and your insurance covers that differently than the screening one. Okay. So, but nonetheless, folks, let me tell you something, $610 as a copay is a small amount to pay for peace of mind when it comes to colonoscopy. And we say that as someone who, we have a very, very good friend who is dealing with a colon cancer diagnosis as we speak. And nobody wants to go through that if they can avoid it. And colonoscopies is a great way to obviously screen yourself for that. Okay. All right. Yes. All right. Okay. Very good. Nice. All right. So let's move on. Class, you guys are ready? Miss Renika, Angelique, Melita, are you ready? All right. Vámonos, clase. Vámonos, vámonos, vámonos. Ay, what a mess last night was. Que planchera, as my Honduran friends would say. OMG. What was that? Let me change my little background image on the screen. Oh my God. I need to have one back there that says, what a mess. Because right now, that's the only way that I can describe, my fellow folks, what happened last night. Lord Jesus, where do we begin? Well, I was monitoring, and I don't actually sit down and watch the full debates word for word. You know, I kind of screen them because that time for me, I start it, but then it's like dinner time. I got to get Gigi ready for bed. 8 o'clock is bedtime. So she wants to spend some time in what she calls the COVID room still, because that's the master suite. Her and dad were relegated to the COVID room when they got the COVID infection. They had to stay in there, and I would kind of scoot little sandwiches or whatever on the feeding tray to them, trying not to catch it myself. So, wow, my God. I started to see messages where you guys were like, this is the worst debate ever. And I thought to myself, how bad can it be? Well, let me put on a little lipstick, yeah, child. It was bad. It was a hot mess. And then some. No, sir. I don't know how to explain it. First of all, Craig Marin wasn't there. And I did reach out to Craig, and he said for personal reasons, he wasn't able to attend. Honey child, this is your opportunity to shine, to outshine your opponents. So I don't know what those personal reasons were, but short of a hernia attack, a heart attack, I don't know what other kind of attacks, asthma attack, like something deadly, I would have been there. Seriously. You make every effort. You know that it's coming, folks. You make every effort to be there. Morning, Richard, joining us from Round Rock, Texas. Caymanians all over the beautiful earth. What? I would have been there. I think this is no bueno for you. And unfortunately, the pickings, listen to me. Okay, let's back it up. Let me tell you guys how bad it is. There are those of you who were saying to me last night, oh my God, thank God that I don't vote in that area. Because if I did, I'd be staying home on voting day, because literally there is nobody to vote for. Listen to some of these comments. Hold on, let me grab a few comments here. And I want you guys to see, oh my God, what people are forwarding, what they were saying. They were just like, Sandy, this was the worst debate ever. My God, that's kind of hard to beat, I would think. But I think it was a combination of a couple of things why you guys say it was the worst debate. we had the two independent candidates, Mr. Tyree Hernandez and Hunter Walton, who, sorry, Tyree, sorry, Hunter, but y'all did not do a good job. I don't feel like you were prepared and you just not ready for this task. I don't know what task you're ready for, but it ain't this one. Ugh, my God. Whoa. Hold on, let me restart the Instagram feed here. Oh, the radio is off again? What the what? Hold on. Is it? Oh Lord. So Jonathan says it's not a debate, it's a forum. Whatever it was, they failed. Whatever the assignment was, no, radio's on. No, we're good on radio. Whatever the assignment was, folks, they clearly failed. It was horrible. Even the parts that I watched, all I could do was shake my head. Mr. Tyrese, what? You don't even know what AI is? You might know how to use it, but I was a bit surprised that you said that. AI is taking over the world. If you want to be an elected official in 2025 and you don't understand how AI is changing the dynamics of the workforce, you see, this is why we've got to stop electing unintelligent people. And Mr. Tyrese, no shade. I'm just telling you. People who are not keeping up with what's happening in the world are some of the most dangerous people to have running your governments. The United States of America would be a perfect example of that right now. We don't need someone as an MP who doesn't even know what AI is. Because guess what? AI is changing the workforce. It's changing how you do tasks in relation to your jobs. Even for me, I was hesitant to get on the AI train, I'll be honest with you. But I felt like, I kind of had no choice because it's here. It's not going anywhere. And so I'm no expert, but I've been kind of dipping my little toes in it and learning. And I'm like, listen, if you don't understand that the tech world is saying AI is going to make certain jobs obsolete, it is going to make humans, I'm not going to say we can become obsolete, but hello, in some instances we will. That changes the things that can happen in our workforce. You guys are worried about foreigners taking your jobs. Yeah, and about immigration. You're 5 years behind now because AI is about to take that job from you anyway. So if you sit there and you're talking about you don't know nothing about AI, Lord Jehovah, please take the coat of many colors, Joseph. You're not ready. I'm sorry. You are not ready. We have to stop thinking about, and in my head, I'll be honest with you. I'm a little bit of two minds about this, right? So I appreciate that we have, local politicians who should never be a minister. They're more like glorified community workers. There's only so much that we can expect of them. I think that they exist and they fill a void and they fill a gap. The problem is when people do not understand that that is their role and that if they were to get elected, that's where they should be. Because then we elevate people to positions that they're not ready for. Perfect example is Dwayne Joke Seymour. Okay? Here's a dude who is T-Rick, morning from Virginia. Here's a dude who is a minister. He has served as acting premier at times. He served as minister of health, and he didn't know the difference between a CPR and a what was the COVID test called again? Oh Lord. The test slips. It's not coming to me now, but I do know the difference. PCR testing and CPR, right? The most he could do during the COVID press conferences was speak in tongues and different languages because apparently he must be an expert in that area. I'm just like, what the hell? Folks, this is what we are dealing with? Someone like him does not deserve to be on the international stage. Now, the unfortunate thing is, let's be very, very clear and honest here. And this is where it gets tricky, right? Because you just do not know. This is the difficulty of it. You don't know what you're going to get. When I say life is like a box of chocolates, you never know what you're going to get. The problem with that, folks, you put someone like him in, they become a minister. That's why when I look at some of these people running, y'all say, okay, let's give young people a chance. All right. But you put them in ministerial positions and they're not ready. We're going to be in a world of hurt, in a world of trouble, right? So I see them arguing that, oh, experience doesn't matter. Experience isn't everything. Discard experience. I got a problem with that because experience matters when you're running the country. It doesn't matter if you're just a regular MP, but there's no guarantees. So CINP, they brought in a lot of youthful people, inexperienced people, and that is a problem from the perspective if they took the government, who's going to be running the show? I hate to tell you, Dan Scott, but as qualified as you are, you can't be every minister, unless you're going to just have them there in title only and you're the one making all the decisions. Poor you would have a heart attack from the stress of having to do that, as well as the premiership that you want. That not going to work. You see my point? And so this is where we've got to be careful. We have to envision people like, can this person actually go away in the UK and represent us? We're always talking about Miss Julie. And I mean, she has 30 years of experience. And we still looking at her with a side eye like, ooh, that's the best that she can do. But I tell you one thing with her, at least y'all like to call me Mount Champion. She's Mount Champion to the second degree because she's way better than me with her eloquence. Now, this is where the other half of the equation comes in because I look at someone like her. Kenneth, very, very eloquent. Somebody said the other day, Kenneth is like a snake oil salesman. And what they meant by that is Kenneth sounds very, very good. And he does sound good. But they say, Sandy, are we to believe Kenneth, given his track record? So a snake oil salesman is someone that you question. Yes, they come and they're smooth, honey child. They can sell ice and Eskimo, but you step back and go, what are we really getting here? So there are different things that you have to contemplate and that you have to consider. Do you want the snake oil salesman who, he will get in there and can sound good, but then you can't trust him? Or do you want someone like Miss Romelia? Miss Romelia can't be a minister. She knows she's not ministerial material. And this is where the second half of the equation for me matters. So for me, I think in my head, you also have to think about not just what the person brings to the table and what they can do, but how much harm would they be causing? So you can be someone who is intelligent, who has experience, but you are a harmful person to this country. So you're going to build a port no matter what we say, what the people vote on, right? You are going to be bought out by special interests. You don't have a moral compass. You will sell the Caymanian people down the river. So for me, thinking of when you go to the polls, who you're going to vote for, it's a two-prong equation, two sides of the coin. Let's look at it from my district. I'm Bordentown West. Chris Saunders. He is intelligent, without a doubt. He also is a snake oil salesman because a lot of the stuff he says, despite his intelligence, he kind of has a lazy streak and he just throws out numbers and figures that sound good, but he hasn't fact-checked things. He says things for political expediency and doesn't really look into it. And I'll give you examples in relation to pension. A lot of the things he said about pension, if you had experience in pensions or you did the research, you would know that he's talking pure foolishness. Okay? He says one thing, does another thing, okay? But let's give him intelligence. He could have been Cayman's next premier. He could have done a good job as finance minister. There's nothing stopping him. He has experience that would have been relevant to running the country. Now, let's look at the flip side of the coin. Flip the coin over. On the harm side, which is where he gets 0 points, he is a very harmful parliamentarian. Okay? He harmed the civil service. He has harmed women in our community, right? He sexually harassed women in this country. He gets up in parliament, makes threats to people. So the harm side for me, for someone like him, is way too high. And it then outweighs the benefit side of, oh, he's intelligent, he's smart, yada, yada. Not to mention he's politically duplicitous. He lies to his, partners, his political partners, I mean. And that's why the last government had such a hard time. You see, people don't want, and the progressive who was pushing this about, we can't have, you see what happened when we had a government of independence. It wasn't that you had a government of independence that was the issue. The issue was who you had in there. You need to look at the individuals that you had in elected office. When you have duplicitous people, they're worse than Spanish machetes, child. I don't know what's worse than a Spanish machete, but whatever it is, that's them. They were cutting each other's throat. And then you had the PPM on the outside cutting each other's throat until Julie could get back in power. And then you had a quasi PPM government back in power anyway with the UPM government. Okay? So they're only pushing this narrative of, the independent experiment didn't work. No, it wasn't the independence. It wasn't the fact that they were independent. It was who they were. And you had everybody trying to undercut Wayne Panton and vie for power. And therein lies the real problem. Look at the root of the problem, my fellow Caymanians, and not just these easy sound bites and rhetoric and whatever. Okay? It makes a difference. So it didn't work because of the caliber of who they were dealing with. All right. Let's think about this a bit further in relation to last night. What a hot mess. Like I said, Tyree and Hunter, nowhere near ready. Did y'all hear when Hunter said that we need to have, I can't remember what the question was, but I'll go back and pull up these clips and share them on social media, that we need to have some sort of agency where people can just go in and just borrow money, like request money, and in 15 minutes they're walking out with a bag of money. You see, this is why Hunter has 7 failed businesses. Okay? He got on the show and mentioned 6. We're going to count the coffee shop now as number 7. I was like, say what? That is how we help small businesses? By government just giving you a bag of money, you come in, 15 minutes later, you walk out the door with a bag of money? Let me tell you something. If you want to help small businesses, I can tell you that is not how you do it. That sounds like Auntie Julie and Cayman Brack. You just throw money at a problem and you think that's how you solve it. Small businesses do need resources, but what they need more than anything else is a think tank and people who can act in an advisory capacity and help them navigate the world of being a small business owner. There are lots of people who have had exorbitant access to money. And I can tell you that did not solve their problems. They still had unsuccessful businesses. They still had failed businesses, because ultimately it's not about the money. It's about what you do with it. Okay? If you don't understand the basics and the fundamentals of doing business, you can have access to all of the money in the world and it simply will not matter. Now, The logic behind what Hunter said is also problematic. And this is a young man who has mastered the game of being a snake oil salesman. It was so funny because last night in my household, we were watching some of it, like I said, and we had a guest over. And everybody's like, why does he kind of sound like Kenneth? He looks like Kenneth. He sounds like Kenneth. And I said, I've said this before and I know Kenneth doesn't like it, but, he does kind of look like a little miniature Kenneth. And he has tried to emulate Kenneth in terms of some of the tactics, going out there doing street interviews and all these other things, right? Doing these video shorts. Maybe what he should try to do for his next business, see if that one doesn't fail, is become a social media influencer of some sort. I mean, I don't know exactly what you're going to sell, because in order for you to be a really good social media influencer, you have got to, you have to come from an authentic and truthful place. You can't just be pretending all the time. And, that's the problem with Hunter. He's not authentic. He's just a pretender. But he's fooled a lot of you because you guys think, oh, yeah, he sounds good and he can put on a little jacket and whatever and kind of look decent. Scratch below the surface and you're going to see that all that glitters is not gold. And that's the fake stuff that when you wear it is going to give you that black mark on your neck and is going to make you all itchy and break out in hives. I'm just saying. He has a tenacity to mention things and recommendations that we already have in place. Once he did it on the show, like, wouldn't it be great if we had a program that helped, young parents with paying for daycare for kids for early childhood? And I'm like, yeah, we already have that. People can apply for it. It's finance-based. You fill out an application. If you qualify, you get the funding contribution to be able to send your children to preschool. Oh, really? It's like, dude, how do you run for elected office in this country and not know what we already have here that's working or isn't working? You see, this is when people are not wanting to do their homework. They just want to shoot off at the mouth, and that's it. And it sounds good when they're shooting from the hip or shooting off at the mouth, but you need to fact check people. What sense is it making recommendations that we already have in place? That means that you ain't got no real solutions. Or what sense is it that make recommendations like, oh, let's just give out money in 15 minutes to small business owners and that's going to help them? That's going to help them fail and then put the country in even more of a deficit than it already is. The worst thing you can do with someone who is having financial problems is give them more money. Do you guys not know that? Huh? Seriously? Do y'all not know this? That's why y'all run into problems with these. Let me take off my jacket because it's getting a little bit hot in here, honey child. What Nelly say, hot in here? Mm-hmm. Seriously. Have you guys not seen the payday, loan to payday businesses? They're high risk for a reason. Because you take individuals who are poor paymasters, who can't pay their bills, who are struggling, right? They come to you because they can't go to anywhere else. There's no traditional bank that's going to be assisting them. And you turn around and you give them money. Oh, geez, on peace. Really? You're throwing, what they say, good money after bad. So when it comes around and then they're like, oh, I can't pay that, because they're people who have no sense of financial responsibility. They need a class. They need education on how to manage their finances. They do not need a loan to payday. And basically, he was suggesting just giving free money to people who've not proven themselves to be able to run a successful business. There's a reason when you go to the bank, the bank wants to know if you want a business loan. Give us a business prospectus. Give us a business plan. Show us what you intend to do. Money oftentimes is a smaller part of why businesses do not succeed. Let me give y'all some real life examples, because I know y'all not thinking when you make recommendations like that, Hunter. All right. Let's look at the medical facility there with the Jamaican guy. What was it called again? Oh Lord, help me out here. He was in HSBC building. The former HSBC building. He had so many lawsuits, wasn't paying pension. I'm picturing him. What was the name of the business? He used to work at Trinke. Help me out here. Who's going to win a prize today by helping me remember the name of the business? Royale Medical. Thank you, honey child. Lady T, you just won some brownies. She's going to love that. All right. Nut free. I'm trying to remember how you like your brownies. Royale Medical. Yes. That hot mess of a situation. He had investors. He had other physicians coming in, giving him money. Yes, Kurt Donald, giving him money, right? He thought he knew how to run this business because he had worked in a similar facility. The irony of it is he used to work for Dr. Deersaran. When he first got started, he was cussing Dr. Deersaran about his failed business and how he wasn't paying health insurance and he wasn't paying pension. He wasn't paying staff. He's making all of these mistakes. All right? Horrible. And he thought that he could do a better job. Why did he think he could do a better job? Only God knows. Only the good Lord above knows. He had no experience running a business before. And the only example apparently he saw was how not to do it, like from a failed business perspective. But it's important to see how to do it. And he didn't have that real world experience. So he goes in there. One of the most expensive businesses that you can get into is the medical profession and restaurants. Because the equipment alone costs money. From day one, you have physicians working in your facility. They're not coming to work there for free. Because of their experience and their qualifications, they demand a high salary. So you have got to have your business model together. And he didn't. And in the end, his business had to shut down. I remember sitting in court, right? And he was there. He moved from they evicted him from that one location. Then he moved to Countryside for a couple months. And I remember Magistrate McFarland saying to him, because he was saying something like, he's learned so many lessons and he could do it over again. She was like, please, if there was a way that I could ban you from opening another business in this country, I would. Because even as you're sitting here talking to me now, owing over $100,000 in pension arrears, no idea how you're going to pay it. You are optimistic that you have learned so much from this experience that somebody should trust you with money again to open another facility. Oh, I could do better. Really? She's like, what she wanted to say is you are delusional. You don't have a clue. But what she said is you should never open another business ever again in your entire life. There's some people who just never get it. In fact, most people, I was having a conversation with Elizabeth a couple of days ago. Most people are better off working for somebody else. Let somebody else have the overhead. Let somebody else worry about your pension. You just make sure you're getting paid and your health insurance. And once you get your salary, you'll go home with no worries. Because when you run a business, there's a lot of moving parts, right? And I'm not saying that you can't learn. God knows you can learn. And sometimes you do learn through failure. And other times you never learn. You never acquire the relevant skills to be successful. And you have to stop being optimistic and be realistic and get with the program. And that's one of Hunter's biggest problem. This kid lives on cloud 9, or maybe it's even cloud 10, and Bobo just don't get it. Now, I'm not saying his heart mightn't be in the right place. But the comment that he made in the end, and I'm going to grab these clips and put them up on social media so y'all can ruminate on these things and think about it. The comment that he made at the end is that if I had a job and I was successful, I wouldn't be sitting here right now. And I was like, Lord Jesus, what you say? That means that you're an undesirable. Nobody don't want to hire you. And you don't have a successful business, so your only other option is to run for elected office? Y'all need to hear the nonsense that people are saying to you, That's what he said in his closing comments. If I was a success in my life and I had a job and I could pay my bills, I would not be sitting here today. So someone admits to being an abject failure and you want them to run your country? Bloody hell. What? No, TD, not today. Oh my God. I'm like, what the? Oh my God. I couldn't believe it. That's your argument for why we should elect you to public office? Are you kidding? Because you're a failure? Because you are a failure in your own life. That's the only reason why you're there. Not because you have anything really to contribute. Not because you can point to anything successful in your life. And I want to now add that to, the complement of the other 19 MPs and help other people. No, you're there because you are a failure in your own life. You cannot make this stuff up. I was mind blown. Tyree, I'm sorry. You're not ready, Bobo. You're not ready, not at all. You couldn't answer the questions. You struggled. You were like, okay, I'll just go with what Perlina said. I'll just go with what, what's his name said. This is not amateur hour. We are facing some really perilous times in this country. We're going to be, whoever gets the next government is going in with a deficit, which we're going to have Mr. Alric Lindsay on tomorrow to talk about. That is serious. You don't know nothing about AI. You don't know nothing about budgeting. You don't know nothing. I'm sorry. Maybe if they ever get the, what we call them district councils going, maybe you can help out at the district council level. I don't even know. Because they got to make sure they have qualified people. Those should not be political appointees either. Should be qualified people at the district council level as well to help move this country forward in a positive direction. Now, let's talk about Perlina. Oh my God. Perlina, honey child, I ain't got no issues with you, except you yourself appear to be a little bit delusional. You've been sipping that special tea that the PPM gave y'all for this campaign, honey child. And all I can tell you is that tea might as well be poison. Okay. Perlina, honey child, would you say that we have a parking problem in Georgetown? Are you still married to Colin? That's his name, right? Not for nothing. But when you talk about the parking problem and we need to revitalize Georgetown, I had to wonder if you were still married. I mean, I saw your ring, so I'm assuming you're still married. You live in the same household? Because have you not had conversations with your husband of how he... hold on here now. Hold on, y'all. Where's my blinkety blink button? Hold on. I'll tell y'all something. Where is it? Oh, God. Let me find it. Because clearly I can need it, Oh, Lord. Where is it? Oh, yeah. Hold on. Ready? I think this is it. Censor button. Here we go. Are you kidding me? You're talking foolishness. Go talk to your husband and ask him how he devitalized Georgetown. That revitalization project has killed Georgetown. We didn't have parking before, and now we have even less parking spots. And for what reason? No, sir. There was a very interesting question that they ask about that one GT location. So this is a hotel that is going to be some residences and hotels, right? It's right there in Gordon Avenue. So the only thing that Hunter could say is, oh, it's going to cause a traffic nightmare. I'm like, okay. And, I had to think to myself, now that Colin has killed a lot of the businesses in Georgetown, they no longer have a coffee shop, certainly not in the evenings or on weekends. I don't think, correct me if I'm wrong, because I don't really go to Starbucks, but I don't think Starbucks opens on the weekends. So people who live or at that Georgetown one. I mean, I guess they'll have restaurants in there and whatever, but wouldn't it be nice if they were within walking distance of a nice coffee shop, some nice areas in Georgetown? Like I was like, they missed some real opportunities at this debate last night. I thought to myself, why you talk about the revitalization of Georgetown? You have GT1, right? Businesses have ran from Georgetown. A lot of them, unfortunately, have shut down, right? You have an opportunity now with a structure that's going to be there that any given time, I don't know how many rooms they have there, but say it's 100. At any given time, you can have a couple hundred people at that one facility. What is there in Georgetown Central, which is part of the Georgetown East for them, that you could hope to offer these people even after hours? There's nothing there within walking distance. Even if you go around like the back way, what's it called? The one that used to be where the old padded people used to be before they moved. Hard Rock Cafe gone. So they can't even walk to Hard Rock Cafe and get a little something in the evenings to eat. There's like nothing there. 5 o'clock, Georgetown Central, deader than a doorknob. But it was interesting that she mentioned some things that her husband has tried. Like she talked about having like a little food festival. Well, your husband has done that a couple times. I've never been to one, so I cannot say how it has done. But the problem is, you can have those food festivals every once in a while. You bring a crowd out for that, and then what happens? How does that actually revitalize Georgetown in the long term? It doesn't, because you have a one-off function, once a quarter, and that's it. That's not the definition of revitalization. Now, let's also call up Perlina, since she was the one who wanted to join with the PPM. Honey child, a lot of the stuff that you were criticizing, including the revitalization of Georgetown, leads directly to who being at fault for it? The very party that you are a part of. So don't think that that is not lost on us. They've killed Georgetown. The revitalization project started under them. And then Kenneth, who is also now PPM, decided to continue the revitalization project and hemorrhage God knows how much money in the end on this project that don't make no sense. That's right, Gabby. It's still a ghost town after 5 o'clock. And even the people during the day now are struggling to find food during the day. Thank God for Burger King. And who else is left? I don't even know. I think that's it. Court staff be going over there. And as a matter of fact, let me say this, because, oh Lord, my little seat a little bit too high. There we go. Had to adjust my seat a little bit. Let me say this, folks. I saw a comment on Facebook the other day. The one little Caymanian guy who is there selling local food during the week, y'all done gone and kill him off too. So I saw, let me tell you what the comment said. Yeah, somebody said they do have the Thai restaurant and Subway and some other little place, all right? But here you now. Mr. Don McLaughlin, he had a little local place right there by the courthouse for God knows how long. He, a very hardworking Caymanian chef, authentic Caymanian food, has now disappeared because I have heard through the grapevine that the Ministry of Tourism and Ports has basically told him he can't be there anymore. Is that part of the revitalization plan? Taking away a little bit of authentic Caymanian presence in terms of food from our visitors and even from the locals who during the week want to get a little taste of something? No, sir. I can't understand it. Lord Jesus. All right. Here are some comments that have come in. Perlina, again, girl, you have got to know that there's certain things that you cannot say during a debate because it makes you unrelatable. You're really not like the rest of us. Okay, let me be very clear. You redefine the word bougie, and that's fine. You can live your most bougie life. That is perfectly fine. But when you want to run for elected office and you make comments like, oh, I would never take a cruise if I can't take a tender. Honey, child, you too friggin' bougie. You'll be fine. Okay? You and them red bottoms will be perfectly fine. Mm-hmm. Now, I must admit, I'm going to give you credit where credit is due. I had a little teary moment with you when you talked about how poor you grew up and how you guys relied, you and your siblings, relied on, as a single family household, single parent household, you relied on free lunches to be able to make it through. And I saw the little tear in your eye, and I felt that was a heartfelt moment, girl. I've given you a pat on the back for that. I felt your pain. And when you're arguing that free lunches make a difference in lives of people, I agree with that too. But there were other times when you demonstrated that those days are far gone in your rearview mirror. So far gone that if you're not wearing the Louis Vuittons and you're not traveling first class and this and that, we just completely lost you. You lost us because we can't relate. A lot of people cannot relate to that lifestyle. Now, let me be honest. I am not here to say I'm some poor person who can't pay my next bill. I'm not in that category. I'm a hustler. Got my little business going, making a few dollars here and there. I can pay my bills. Okay, they get paid. But child, y'all tanked it. This person says, I'm watching the chamber forum for Georgetown West. This was last night. Where is Craig Marin? Why is he absent? Another person said, I didn't realize Georgetown West had such bad candidates. They're all donkeys. Oh, fada. Comments this morning that were coming through. Good morning. I was so exhausted last night after the chamber forum. The best part of the entire night were the comments on CMR Facebook feed. My takeaways. Perlina commenting on the lack of parking in Georgetown when it was her husband whose revitalization plan took quite a few away. Hunter's confidence that he'll be the next successful candidate for Georgetown West. Like I said, he lives in Cloud 9, bless his little heart. Tyrese's plan to save money for Cayman via the prison system. Send foreign prisoners back to their home countries and work our prisoners. I must admit, I laughed too hard at a truly scary and concerning situation. And this is why, again, I go back to Craig Marin. Where were you? This would have been your opportunity to shine. This person says that was the worst debate last night. This other person, one good thing about Perlene and her sisters, I got to give them credit. Big shout out to Judy Faye. I'm a little friend. They support each other no matter what. They got each other's back. And maybe some of y'all Caymanians could learn a thing or two from that model. But I don't know how realistic they're being. Nonetheless, this comment that someone just said they screenshot what her sister put up, what Judy Faye put up, and said, these questions are so long, was one of her remarks. I was embarrassed. Perlina, you mean to tell me that you were not sitting there watching the other debates when they happened? Sorry. You were surprised that the questions were long? What kind of preparations did you do, honey child? I mean, I would have thought if I were preparing for these debates, one of the things I would do is actually watch the debates. And you would know how the debate questions were formulated and how they came. So how you are sitting on top of the questions too long? Okay, honey child. What preparations did you do? My God. I I watched them all, but last night they could not even hold my attention. It was so bad. Somebody says, Hunter, if a business doesn't want to hire Caymanians, that's fine. So just tax the company with a higher fee. I was confused. I was like, really? Also, he mentioned about higher teacher's aid. Really? There is teacher's aid in most of the classes. I heard that question about taxing businesses too. And I again, confused. This person said they actually fell asleep. Lord have mercy. This one says, I'm absolutely okay. Hold on. Let me screen grab this one for you 1 second, so we can read it together. Oh Lord, hold on, Mama. Hold on. I'm coming to you. All right. Let's get some more questions, some more comments here up on the screen. But collectively, everyone, I mean, I was even requested, Sandy, when you put up the poll, can you please put up the option that this was like nobody won this debate because it was so bad? I've never had anybody request that of any of the other districts before. And that demonstrates the poor performance. I mean, I can't help but wonder if Craig showed up, what was his performance going to be like? He's left us wondering. And I think he actually has done himself a disservice by not showing up. Because I don't know. I mean, I guess his only real competition is Perlina, but at least she showed up, is what some people might be thinking. But I tell you what, a lot of people are not going to vote for her because she's PPM. And here's what one person said. I am absolutely terrified that we end up with a PPM government again. This situation we're in right now is scary. We're in a huge deficit, and Judith Sana is lying and telling the island that we're in a sound financial position. Meanwhile, we have these jokers who do not understand our dilemma, making fools of themselves out of form. One out of their fill in the blanks for those who are on air. And like I said, Juliana has learned a thing or two from being a PPM member for so long, which she never resigned from, because they believe in overspending on huge capital projects. And so that certainly is right up her alley, as we can see. Here's another one. The comments were the best part. When Perlina said that she wouldn't get on a tender boat, and the comment came back that was because she was too proud. So Marshall was there last night, says, you too extra. That's why you wouldn't take a tender. Well, I guess she's more extra than the millions of people who come here every year and actually take a tender and get off the shores. Lord Jesus. Miss Lily was saying solutions, ? This person goes on to say the revitalization of Georgetown was done for the cruise ship pier. The intention is to pedestrianize the entire area, a complete waste of money, totally underhanded planning. Interesting. Well, they've definitely tried to pedestrianize it. And I can tell you what, the sad part about that is even the tourists, when they get off, they're not really walking around it either. I mean, I don't know if you guys are noticing. This person says, Lord Jesus. Hold on. Let me get the comments up on the screen. Radio folks, at 9:28, your feed will end. We'll continue for a little bit more on social. All righty, here we go. This person said, good morning. First and foremost, the candidates need to learn to speak properly and articulate themselves correctly, not mispronouncing words and phrases and not speaking correctly. Most of these candidates are painful to listen to and also a mockery. I honestly don't think that Miss Amelia did much better than the three last night. Alfresco / Latin Taste, the Thai Orchids, they're mentioning some other restaurants that are in there. Well, listen, to give Miss Amelia a little bit of credit, she also does not boast about having a law degree, a master's degree, and some associate's degree. So I would have expected better performance than these people who claim that they've run businesses and done all this other stuff. Miss Amelia is not overinflating her credentials. Let me be very, very clear. She's telling you what she's all about. She's about trying to clean up her neighborhoods, getting rid of derelict vehicles and trash and this and that. Somebody else said Ramelia did better than the three of them combined. That was another comment that just came in. Oh my God. This person says, I need some nutty brownies. Hold on now. Am I first? No, you were not first to get the answer. But I'll make you some brownies anyway. Now, this one is interesting. They said, after the brownie comment, that in relation to Festa, they said, call it what Festa called it, re-violation of Georgetown. Did he say that on purpose? Or he wasn't meaning to say violation, re-violation? Did he actually say that? No. You gotta be kidding. Yeah, somebody says, yes, wasn't Maldine's daughter husband who made that mess in town? I'm assuming that's their mommy's name. That's Perlina's husband. Yes, that is her husband. Now, I can't say that she controls her husband and what he does, for sure. But honey child, work with me here. What you don't do is talk about the mess that it's in when you're sleeping with the person who kind of helped create the mess. This morning says, good morning, Ma. Exactly. I'm also in Georgetown West. What a waste of voting privilege. I've had a lot of people say to me that they're not going to go out and vote. Anonymous Sandra, ask her to tell us for West Bay who she thinks is smooth, but still not good country and will or has sold us out. There are a few smooth ones. I'm lost here. Ask her who. She said something about somebody being smooth, but not good for the country. Perlina said that or what? I don't know. This person that says, I wish the PPM was as dead as Georgetown now. Oh, good morning. Craig Marion was a complete time waster. Just shows what a donkey he is. Won't be getting my vote. But who are you going to vote for of the rest? That's what I want to know. I mean, Craig didn't show up. And you see, this is why I'm like, oh man, he missed an opportunity. This person says, President, good morning, angels, just tuned in. All day opening up business is to get money and to try to play the biggest. Teach them, Sandy. They think ego sell to smart people. Perlina and others, the proud shall be brought low. Oh my God. Another one says, well, if those questions are long, you can see how going to England, you can see her, going to England to represent us, the Cayman Islands. Vote smart, Cayman. OMG. No, sir. Another person says, ironically, it's Perlina's husband that's responsible for the revitalization project. Yes, we've been talking about that. Hunter didn't do his homework. Ramelia did better than the three of them combined. Oh my God. Here's a message for the PPM. Hold on, coming through. Lord Jehovah, radio listeners, switch over to social media. This person says, no one. They're all undesirables, just voting in the referendum. Oh, damn. So I think Georgetown West might have one of the lowest voter turnouts based on the feedback that I'm hearing. No, sir. Ay, 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 caramba. Morning, Sandy. By the way, who is this Leon running, I think, as a candidate for Red Bay? The only thing I see from him is his billboard sign in Red Bay. Honey child, whatever you do not vote for him. He's the one we talked about who was in court for digital penetration of a woman as he was moonlighting, pretending to be a taxi, using his mom's taxi. We went into this in great detail, just go back to that show, but using his mother's taxi when he did not even have a taxi license. And then he was arrested and charged and got off, thanks to a jury of his peers, for digitally penetrating a woman. Good morning, caller.
Good morning, Cousin Sandy.
Hi there.
Man, you're on a roll this morning. I love it. I love it.
What a hot mess, honey chill.
Yeah. Hey, this country is in one mess, let me tell you.
Can you believe it?
And I don't really see any good, clear solutions.
Huh.
So
I don't
boy.
I don't see some good, clear candidates in some of these constituencies.
Exactly. Anyhow, just before you cut off, the mangoes are started wiping up again. So I got some.
Listen, please don't forget, I don't like them ripe. I like them turn.
But I got those too.
Well,
got turned,
all right.
got grown,
Yeah,
got turned, got grown, got right.
Okay, I want them turned. I don't want them ripe, and they got to be firm. I don't want no hard spots, because when I cut them
Really?
and I put my little seasoned salt and pepper and my little vinegar, I need it to be nice and firm to bite into.
I hear you. So we make an exchange.
So are they ready? Are they turned yet?
Yeah, of course.
So I can get some today.
Today, this morning, whenever, you can send the same lady you sent to my house.
All right, she's pregnant now, so I'm gonna have to find you. But just WhatsApp me some directions, and I come get my mangoes.
Okay, so just bring me some brownies. Let me make some.
No problem.
Okay,
Sounds
all right. We
good.
talk some more.
Okay, hon. That's a good trade. Brownies, return mangoes. Yeah, boy, them mangoes. You folks, it is mango season. And if y'all don't know that I love a turn mango, oh my God. And the best ones are the local ones, the little local round mangoes. I don't want them big East Indian and Julie and this and that. No. Just give me my little local mangoes, honey child. They are so good. They're so meaty and I had some this weekend. Which reminds me, I need to go to the woman at the farmer's market. Big shout out to Miss was it Angelique? She allowed me to get some mangoes on credit. I was supposed to go yesterday and pay her. Lord, you must have thought I forgot her. I'll come in today, honey child. I never left home yesterday. So I'll come in today to pay you, and hopefully I can get some more from her too. Support local farmers. Did y'all see my interview? I went there to, I was passing by and I said, oh my God, I wonder if they got anybody got any turn mangoes. Plums. What about plums? Any local plums? Somebody please get me some plums. Anyway, so yes, so I turned in there and I ran into Auntie. Sorry, Anthony Ramon. I ran into him buying some of his little local peppers and stuff like that. So we had a little chat. Melita says nothing is free. You better believe it, but that's a fair trade. I'll give him some brownies for them mango. Oh yeah. Honey chill. And now Gigi's getting into it, but she don't like the seasoned salt. She like regular salt, but she put the whole thing of salt on. I try and sprinkle just a little bit. But yes, it's that time of year. And Mr. Crawford, let's give Mr. Crawford a big shout out. Mr. Crawford has a beautiful, I don't know if it's like a hybrid a little bit, because his local mangoes, they be so nice and thick. You know, sometimes we like things that are thick around, yeah. And they be so nice and thick. And I'm like, oh, Mr. Crawford, thank you so much. And you know who else has a really nice local tree? Dan Scott and his wife. Yeah, she's giving me, Lisa's giving me some in the past. Now it's political season, so I mightn't get into this year. She might be like, Sunday, you can't get none of my good mangoes this year. Sorry for you. Lavana says support local. By the way, big shout out to Lavana. You guys know that she had a little restaurant there in Georgetown, down Windsor Park area that, unfortunately it didn't work out. And so that's okay because, sometimes again, our businesses will fail. Nothing wrong with that, honey child, but she's going to keep trying. So she is now in that space. And I must tell you, it's so pretty how she has it all fixed up with painted trees and everything. She has fixed up a laundromat in that location as well. So the restaurant came out and she fixed it up, got her a few washing machines, coin operated. So you guys can go in there now and do your laundry. I think that's a really good idea, Lavana, because one thing about laundromats is they're less labor intensive than restaurants. Because restaurants, you need all this equipment. You got to have people in there cooking and serving food and this and that. It's like a lot of hands, right? And a lot of equipment too, pots and this, that, next thing. Your initial investment are those machines. But once you've made that investment, then hopefully you start to make a little bit of money. And I see you got a couple of things on sale so people can come and buy their little laundry supplies and stuff. So yeah, congrats on your new business venture and all the best to you. Good luck. Yes, honey child. I know the hustle. Mary Star says, and that's the problem. They feel superior. They forget their success still lie in the hands of the voters. Good morning, Miss Siobhan. What do you mean, what kind of plums? The local plums now? I need some of them. Yes, sir. Auntie, what about the tagine sauce? Where that is? You got some from here, what? Yes, sir. Carla says, boy, she barding. Carla got a little taste of the mangoes, too. All right, mangoes. Siobhan says, nice, Lavana, praying your business a success. Indeed. All right, let me see what else we got here now, honey child. Did you want Scotch bonnet and seasoned peppers? I have a little bag for you this Friday. We'll message you. Oh, yes, I'll always take Scotch bonnet and seasoned peppers because Miss Stacy, she like to put seasoning in food, honey child. Somebody has a puppy in their yard. Which area is this? Anybody missing a brown dog this morning? All right. Okay. All right. So, by the way, do you know that Leon Gold is Tristan Hyde's brother-in-law? Okay, Leon Gold is Tristan Hyde's brother-in-law. So does that mean Leon's wife is Tristan's sister, or is that on the other side? So Leon Gold is Tristan Hyde's brother-in-law. Well, we can't pick family. And obviously, a lot of times we can't pick in-laws either. So good luck to Tristan and the rest of the family on that one. What a hot mess. I've only forwarded and edited to have it make sense. I think candidates the author's referring to are Matt, Julie, and Raleigh. Well, those are the only ones in West Bay. Well, Kathy, but I don't know who. I don't know. I almost didn't want to go vote either for Georgetown West, but I'm afraid Perlina or Hunter will get in because we don't go and vote. To talk about a rock and a hard place. This is the thing too. If you don't get in, if you don't go and vote, you give somebody a chance who really shouldn't get in for sure. So, what a hot mess. Ay. Let me see. And don't forget, we got the referendums to go out. I don't think I use this sauce. Normally we just make our own sauce. Oh, I can try it. Where do we buy this tahini sauce from? That's the one I think that they use in Miami when they have the little mango places. All right. Tristan Hyde's wife and Leon's wife are sisters. Okay. Oh, that's who his wife is. Oh, that's interesting, because interesting because somebody said Tristan Hyde's wife be making him broke with all her special requests and stuff, but what mess. That who it is? Oh, okay. How many sisters are there? Because I know another one of the sisters, but I don't think that she married to Tristan, but I'm not sure. I can't swear for any of that. Leon is married to Tristan's wife. Leon, he not got no job. Dude is lazy. I guess he's not moonlighting anymore since the wife is a lawyer. Hurley's has that sauce. Thank you so much. I'll go check it out. So I saw him at the salon the other day. He's one of those men that drives around in the woman's Mercedes while she's at work. He's driving around probably looking for another victim to be dragged to court about and then claim that she was the one who was trying to assault him Because he never said he didn't do it, you know. This was the very interesting thing about that case. He actually never said he didn't do it. Now, stick a pin. Oh, thank God it's after hours. Don't make your kids listen if they were tuned in. They should be in school anyway. They shouldn't be listening now. Let me just say something about that case that really bothered me. There's a lot that bothered me, right? But if I were sitting there as Leon's girlfriend at the time, she went on to marry him after these allegations, girl, and she has a daughter. She got a cast iron stomach. Because if I'm with a man and he's moonlighting as a taxi, now keep in mind she's some big shot lawyer supposed to be, right? She's a lawyer. If I'm a woman and I'm with a man who is dragging through court being accused of penetrating a woman digitally, that means with his fingers, in case y'all don't know what that means, and fondling her up and whatever while she's on her period, how fucking disgusting is that? Excuse my language, but we're in the after hour time here now. That is disgusting. That do you see? This is why I know that his story wasn't true. No woman in her right mind wants y'all messing with her when she's having her period. I know some of y'all will make a little exception because you want to keep your man from going out of cheating, but a total stranger, you got to take his hand and put up your vagina along with a tampon. Come on now. You know that's next level ridiculous. No, women don't do that. Sure. He's a damn liar. Let me try and fix my hair in one ponytail so I can tell y'all the cold hard truth. That's a bunch of cockamamie. Oh, Instagram, you get cut off again. Hold on, honey child. Oh, this Instagram thing is annoying. Hold on. I never believed that. I'm sitting there going, ew, that's nasty. You know, I guess if you're in a relationship with someone and you warm up to them, maybe there's certain things after a while that you might allow them to do. When you've been with them for 10 years, y'all women know what I'm talking about. Some of y'all nasty. You be wanting to suck their grangine toes and all kind of stuff. Ew. So, you know, when y'all desperate for man, you make them do all kind of stuff. But anywho, let me allow Instagram to come back online. Hi, Instagram folks. Every hour we got to restart your feed, honey child. So, okay. I try to put myself, because she showed up every single day to court, and I try to put myself in, what's her name? Arlette? I try to put myself in her place, right? If I'm sitting in court, they're supporting my man to say, oh, he didn't sexually assault this woman. The second he said that it happened and his fingers were in her vagina, in her vajayjay, while she was on her period, I'm like, so he just admitted to cheating? Because he's blaming her, saying she's not the victim, that he was the victim. But how does that change the fact that your fingers were in her vajayjay? They were still in her vajayjay and you just admitted it in open court for everybody to hear. All the Cayman Islands know that you're going around pretending to be a taxi driver, pick up a total stranger, and then somehow your fingers end up in her? And I'm going to not only stay with you, but marry you? Arlette, your stomach is better cast iron than my kitchen pots. I'm sorry, but under no circumstances could I end up with somebody like him. I know out here in these streets, women, we are desperate because good men are hard to find. They're either married, gay, or women beaters, possibly murderers, or something else to them. I don't know. But I'm sorry, you ain't get in court and admit to, hold on. How is it even possible? Now, I'm not saying that a woman can't rape a man, because we know that's possible. He could be intoxicated. He could be sleeping. She could be stronger than him, heaven forbid. But you see this little English lawyer, she not got no strength over this man. How she got to grab your hands and stick it up her vagina? You're a disgusting piece of shit and a liar too, as far as I'm concerned. That story never made no sense. But Arlette, how can you stomach being married to him? Oh my God, I can't talk about it anymore because it makes me physically sick thinking about it. But this is who you gonna lay down with every night and to be around your girl children? A man who can talk foolishness about the alleged victim. Her story was very different than his. But she can grab your man's hand and make his fingers go up inside her vagina and he couldn't stop her? I know you fooler than him. No, sir. So whatever you do, don't give Leon no votes. If he get 10 votes, I'm plenty. Red Bay, don't fool with that man. I'm sorry, but you got good options in Red Bay, actually. And he definitely not one of them. So if you're hearing this for the first time, Siobhan, we've done a show on him. Permit me to give you the show link, because if you vote in the district of Red Bay, I would encourage you to go back and hear the entire show. Hold on, let me find it now, about Leon, because this was back in 2021 when he had this allegations against him. Where's the show? Okay, let me try to yeah, his lawyer sent us a letter last time we were talking about him to say, oh, he was vindicated. Yes, he was found not guilty, but I still need to examine the heads of all those jurors. So go back to January the 3rd. And if you find the show, let me just I need to have Misha hyperlink this. So just go back to January the 3rd show. You can also find them on our website. But by the way, just as a side note, Facebook is going to start deleting all archived, like all the older show videos. So we are in the process of grabbing and taking down our shows so we can have them separate. CMR TV is coming soon, folks. You know, we had our TV logo for years and we were doing the news under CMR TV. So by all means, keep your ears and eyes out for that, because, you know, we keeping up with the times. Ain't nobody gonna be coming down, and giving CMR a run for their money. We're gonna keep them on their toes. Ha ha! Take that, honey child. Yeah, Mirror Star. Oh, this is his wife. She is very pretty, I must say, but woohoo, I would check up there. Arlette is married to Leon. Karina is married to Tristan. Original name was Shiara. Oh, did she change her name from Shiara? Because I was like, who the hell's Karina? They're from Panama. They really insecure and they love toxic, abusive relationships. This is what this person says. Ooh, honey child, they got the tea. Oh yes, but I'm confused. Did she changed her name? Ciara is what I remember her as. She changed it a while. So that's who's. Ay. No wonder he got problems. I mean, let me rephrase that. Not problems, but no wonder. He has to travel to Miami a lot to keep her happy. Mm-hmm. I will say no more. I think Tristan seems like a nice young man, but once again, y'all love a Spanish woman, though. Yes, sir. They be making your toes curl, I hear. Woo! I think on election day, I better start drinking. Oh my God. You guys know I don't drink. That's a joke. Lord Jesus, y'all be reporting me to the pastor now. They're really insecure and love toxic, abusive relationships and will do anything for money. Well, she's not doing nothing for money because she's the one making the money in that relationship. Leon using her for the money. Arlette was in a whole other relationship, living with another man, cheating with Leon. That's why she ignored a lot of stuff that he did. Oh, you're saying that when she was married to that nice little Caymanian guy, he was a civil servant too, I forget his name now, that she was actually cheating with Leon? Oh, so he was a side piece. Oh, I guess that's why she just ignores everything that he does then. Okay. I got you, Bobo. Boo-boo. I got you, boo-boo. Wow. The sister changed her name and did her body as well. Really? Why did she change her name? Interesting. Huh. What a mess. Yeah. I tell you what. No, sir. Marshall said his wife is a lawyer, but that's just her major. It's clear that her headpiece isn't too bright if she then turned around and married him. Watch how that man lawyer is going to sling you down today, Sandy. I know they're going to send me another letter. Alfredo, buenos dias. Cayman Mall Road, not only that, we put her kids on the side. To please Leon. Call Nino her second baby father. He will tell you all about it. He's the one who has the son majority of the time. By the way, Arlette was engaged with poor Nino, but was cheating on him with Leon. But she was served with karma when Leon caused her all the embarrassment with the sexual assault case. Well, Alfredo, let me tell you something, honey child. That's not even the most embarrassing thing. I mean, that one went to court. But what is most embarrassing are the other women who are out here with all these stories about Leon sexually assaulting them as well. He seems to actually be quite prolific. I mean, not for nothing, but honey child, what a hot mess. Amaya says, what do you think about Natasha and Dawn? Can't say much for the others. Well, I was pleasantly surprised by Dawn because I don't really know Dawn per se. But I must say that I was pleasantly surprised at how intelligent Dawn was. Dawn did very well at the debate. She held her own fantastic. Natasha did well, but there's one question that she missed. I already told you guys that. But Dawn has an IT background. I don't know why she's messing with this bar business. Dawn, you lowered yourself for God knows what reason. But she has like an IT qualification, IT background. She's actually a smart person. But again, some of the other personal things that are messy, I don't know. I think y'all gonna be too caught up with the vajayjay stuff to really focus on what you need to be focused on if you get elected. I'm just saying. Lee says, I don't think a woman can rape a man. She can. This is legally accepted because the manhood would have to be stiff. Well, Lee, what happens is men's ability to get it up is a physiological response, not necessarily a psychological one. So a man could not want it, but say, for example, he's sleeping. Sometimes men are sleeping and they have a hard on. This is, adult sex education 101. She could just jump on him and take advantage of him. And that would be rape because you can't take advantage of someone who's intoxicated or who's sleeping. Whether they are a man or woman, it would constitute rape. And there have been cases of men being raped by women. They did not want it. And the woman still forced herself on him. And because he couldn't help it, because physiologically, that means his body's going to respond to stimulation, right? So it's going to stand up. And then Lord knows if she's jumping on it, it's rape. If she does other things to him that he might not have wanted, that would be sexual assault. So yeah, it can happen. So don't go around raping nobody, folks. A.D. Harding said earlier, CINP candidates are hardly running in their districts. You look at where they're registered to vote and where they're running, and it just screams little thought has been put into this. Well, A.D. Harding, I think you mean in terms of where they live versus where they run, but you don't have to run where you live. And a lot of people don't. Take, for example, Arden McLean. Arden is from East End. He's an East Ender. He ran in East End because that's where his people are. But he's lived outside of East End probably most of his adult life. What's the other one name again? Kurt Tibbetts. Kurt Tibbetts has lived northward as long as I can remember, and he ran in Georgetown. So you don't have to run where you live. You just better do a good job when you're there. Mirstar Jonathan says a one-legged donkey with terminal arthritis in that one leg would be a more suitable choice to help carry Cayman forward in any conceivable realm of cognitive sanity when compared to the alternative incumbent choice. Lord Jonathan, even when you write, you make my brain have to work overtime. Let me digest this. A one-legged donkey with terminal arthritis. One-legged donkey. Okay, I got the visual. And that one leg would be a more sensible choice to carry Cayman forward in any conceivable realm of cognitive sanity. Look at him in these words, cognitive sanity, when compared to the alternative incumbent choice. But if you're speaking about Georgetown West, the incumbent was David White. And I would agree with you. His cognitive ability was lacking. His ability to produce and do anything was lacking. And now he is supporting Parlina just because she has joined the PPM. By the way, did anybody notice that he was there last night sitting in the back? So they sent him out to support her at the debate. I mean, not for nothing, Parlina, but if I was looking for an endorsement, I would not have asked David to give me that endorsement. I guess that probably wasn't her choice. When you join parties, they tell you what to do. But God knows he not did nothing. So why is he endorsing you? The man does he even know you to endorse you? Anthony says, Sandy, in these parts, Sandy, is this party contract that was signed by some of the candidates legal? They will seem to obstruct a formation of any other government in the best interest of the citizens of this country. They appear to be an obstruction of democracy. Well, the last time that I checked, obstructing democracy was not an offense, and it certainly, Anthony, unfortunately, does not make a contract what's the word I'm looking for? Illegal or unviable even. I think what it does, to be clear, is it just demonstrates the insanity of some people who want to control the narrative about every little thing. And also what it demonstrates is that those who signed the contract were only thinking about the $5,000 a month and then the additional 10 grand that they would be, getting to run their campaign. However, be smarter than them. The contract does not say that you can't resign from the party and join with somebody else. So there's your out from the contract. There's always an out from the contract, honey child. Take it from that law degree. I studied contract law. Ay. Anthony says, Sandy, you're wrong. Hunter doesn't sound like Kenneth. He sounds like little Elio. He reminds me of Elio, good talker, but when you go there and got nothing done. But when he got there, he got nothing done. Last night, I referred to him as little Elio or Elio Jr. Oh, God. Morning, Black Pearl. Black Pearl says Georgetown West is doomed. Oh, hold on. I'm trying to click on your comment. It's not letting me. Georgetown West is doomed. Last night's forum was a disaster and a disappointment. Craig came around one evening, confirmed that he's having a meeting on the 19th of March on Smith Road, Hope Drive, and didn't show up. What? What do you mean he didn't show up? He announced he was having a meeting and then there was no meeting? What? So, honestly, who are you guys going to put in then? Lord Jesus, what the hell? Oh my God, I'm disappointed to hear that. I was hoping Craig would have been able to put it together. Somebody said good talker, sigh. Well, I'm not of the opinion, Anthony, that Hunter's even a good talker. You and I will have to disagree there. But anywho, wow, Georgetown West, Jesus. Oh my God. Oh my God. So, you guys seem to know a lot about Arlette. Hot mess. Here's another comment about that situation. Your screen has gone terribly busy, blurry, you need to refresh. Oh, hold on, my apologies. Un momento, por favor. Is that any better? Let me check the feed on Facebook. My apologies. I didn't know it had gone all wonky on us. Oh God, Jamaican police killed 6 men on Monday. Wow, they're cleaning up shop. Jeez. Okay, so here's another comment about Leon's situation with the wife and about her, really. I didn't know she was really that type of woman, but I hate to tell y'all, you know, some of these women have a reputation, honey child. They do them better than anybody else, I suppose. And, you know, there ain't going to be no loyalty there. All right, give me 1 second. Strong Will, I don't know, Strong Will, your comments are always being hidden by Facebook. I only see it when I go on the Facebook stream because I see them in my thing, but they're always being hidden by Facebook. I don't know why that is. That's like so weird because, I mean, your account has been around for a minute now, but Facebook always, okay. So this person says Arlette was also cheating on her first child's father that she was engaged to. He even helped put her through school, I believe, in the UK. Well, I'm a rapist. I rape mine every night, but he must be love it. Lord Jesus, that's not rape. If he's willing, you can't rape the willing. Oh my God. Try to behave yourself, young lady. Jermaine says on another note earlier, I've been watching these debates. In my opinion, they're way far away from a political debate. It is more like candidates promise public note than anything else. Yeah, I mean, that's why I guess the chamber calls it a forum. It's me calling it a debate, but it's as close as we had to debate, really. So I don't know. Voyager says, I find it hilarious to listen to the new PPM candidates talk about the issues that came on Faces today. I have to continually ask myself if they believe that the PPM just formed in the last few months. Thank you, Voyager. They created the problems because they were there for the longest amount of time. Island Pearl says, after listening to the forum last night, if I was in that area, I wouldn't even waste my time to vote. Who would I choose? They are all lost to me. As bad as the lady was, she got the most points. So sad, shaking my head. And ultimately, I think I agree with that. Let me check the polls to see what the polls are saying. Oh, by the way, did I send out the poll? Hold on. Let me see now if I sent out the poll. Let me send out the poll. Go vote in last night's Georgetown West debate. Who won? Craig Marin wasn't there, unfortunately, so obviously his name is not on it. So let me just pull this up. Georgetown West. All right, one more debate tonight, and then tomorrow it ends with the leaders debate. I gotta tell y'all something about the Compass. They're shady boots. All right, Perlina here getting drunk off PPM Kool-Aid. If they only chose her because Craig was already in a party and they had no one else to run in David's place, imagine if she ran against him twice and lost. Now she wants to get in so bad, she's willing to swallow some of that pride to use David to take her around to households. I'm hoping they will warm up to her, laughing out loud. She best just spit back up that pride because we still don't want you, girl. Ooh, yikes. So who y'all gonna put in Georgetown West? We're gonna reset the polls here shortly, by the way. So we can see who you guys are thinking about voting for. All right, so thanks for letting me know it's coming up fuzzy. Someone said, yes, Dawn did well. They were both born in Panama, but they have roots in West Bay through their grandfather. That's why their maiden name is Chiara Powery. Oh, okay. I see. Well, look like they got the Spanish ways, though. I don't know about the West Bay roots, but anyway. Morning, Auntie Sandy. I keep forgetting about the dash cam. Let me know where I can pick it up or I work at, okay, no problem. If you're on the road anytime today. Yes, honey, you already paid for your dash cam and you not got it yet? Lord Jesus, I will bring it to you today. I will, because I got to go town and go by the farmer's market and pay my bill. I need to go get my hair done because I've been looking like a hot mess. I need to do a wash and blow dry. I also need a mani and pedi appointment, so I'm going to call. I think it's going to be a spa day today, honey chow. Papi, says this one. Spanish people like their freaky nastiness, like eating their shit. Lord have mercy. Sex with periods, sex in the back door. Lord Jesus. Well, they're not the only ones. Some of y'all are Spanish and you still like it. This time around, I'm voting to keep PPM out. That's quite an indictment. So I'll send that straight to Joey Hugh. And Kenneth. Oh, sorry for you. What a hot mess. Come pick up some mangoes. You got some too? Oh my God. Oh, we're going to have so many mangoes. They better be turned mangoes now. I don't want them too green and I don't want them ripe. Okay. Leon is married to Tristan's wife. Leave that alone. They have nothing to do with political mess. That's BS. She's a very successful insurance vice president. People need to go sit down. Oh, you mean Leon's wife? Yeah, she just has poor, decision-making, obviously, in her personal life, is all people are saying. When you get into politics, you're judged by your spouses, especially when they're political figures. So y'all want to run for politics? You better make sure your wives aren't hookers and whores. And if you're a female, that your husbands aren't there screwing down half of the Cayman Islands and beating you, because all of this stuff become fair game. RMR says, correction, the 19th of March was Craig Mearns' meeting on Hope Road, Georgetown West. But did he show up? Because I'm confused. Oh, RMR said, yes, he had a meeting. Okay, I was confused. Strong Will says, Sandy, Kurt Tibbetts is still running Georgetown because he tells them what to do. Well, let's see. Because he's out there trying it. He hasn't had to do it in a while. Let's see how influential he remains. Because outside of those older folks, I don't think Kurt Tibbetts can have no influence on nobody when it comes to PPM. Y'all fucked up the country and you had enough time to do it. So no more of that PPM for you. Sorry. Oh my God. Mirstar says all Georgetown West voters stay home and don't vote, host a strike on election day. No. Don't do it. Don't do that. Because number one, you got to vote in the referendum. Because if you have a low voter turnout, especially for that port thing, all the pro-port people are going to say, well, the people don't even care. So go out and vote. Kill them with the votes, honey child. All right, let me check the vote results from last night. Let me see here now. Let's check our straw polls. Let me see. Y'all laughing about the Georgetown West debate. Y'all like, Jesus, nobody won that. Good morning, caller.
Morning.
You got some mangoes for me I can trade for brownies?
Oh, by the way, your brownies were good, but I'm not sure how good they are for the waistline.
Oh, of course not. I mean, I'm not trying to tell people to overindulge in brownies because, we're all trying to be healthy.
I just wanted to say to people that the idea of not showing up at the polls is not a good one.
Exactly.
The reason for that is very simple. I'm going to make this short.
Thank you.
If every voter stays at home and there is a vote and there is a candidate who lives in the district in which that candidate is running, and the candidate votes for themselves, meaning they only got one vote, and all of the voters stayed home, that one candidate would win because he has the majority. You need to understand that.
Yep. It only takes one.
I give an extreme example,
Yes.
but understand that that's how it works.
Mm-hmm.
So do not think that by staying home, you're doing some great service.
Yes.
That's a really bad idea. Take care.
Thank you very, very much. I agree with Denny. Get out there and vote. I mean, like I said, it's going to come down a lot of times to just picking the lesser of the evils. Who's going to do the least amount of harm? Trisha, where the grass is green, 345, says, please, you can't keep telling people how and who to vote for. This is ridiculous. Well, Trisha, it's ridiculous that you can't even fucking spell ridiculous. How about that? Spell ridiculous and spell vote correctly. That's what's ridiculous round, yeah. God damn it. Rourke Man says, who should I vote for, Sandy in Georgetown West? All I'm saying is the pickings are really bad. I didn't tell y'all who to vote for in Georgetown West. I told you who not to vote for. And then, you can figure out the rest. Lord have mercy. Black Pearl says, not one single vote from me for any PPM candidate. And Trisha, in case you're missing the memo, it's the people who are telling each other who not to vote for. And I'm simply here reading the comments. I'm just calling them out, all of them, for the hot mess that they're in. No, David can't run. Albert says, so does that mean that David will meet in the seat? No, David is not running. That's why he's endorsing Perlina, because Perlina is his PPM replacement. What I'm saying, that sounds like a hot fucking mess. Merstar says, kaboom. What a mess. I wish I'd put Zeus in the race because he would have been a better alternative. I'm just saying. What a hot mess. Lord Jesus. I don't know what to say. Moya says, vote, guys. We're still seeing the consequences of not voting from other countries around us. Yes, I think that unfortunately, you got to just pick the lesser of the evils. Ah, Lord, I don't know what to say. All right, let me see the results now. As a matter of fact, y'all are not even voting in the poll yet. Go vote. I just put it up. None of the candidates, 63.16% of you said none of the candidates won. Then coming in second place is Perlina Hunter with 7.89% and Tyree Hernandez with 5.26%. I have not yet voted in this. Let me see how I'm going to vote. I'm not going to tell y'all. Okay, I'm casting my vote now. Oh, it says VPN user not allowed. Hold on. Let me come off. Let me. Search can do it properly. So that's why I'm using a VPN, child, because I don't want no UK results. Zeus was a win for sure, right? Wow, laughing out loud. Didn't know a typo determines learning, Sandy. But hey, no, now I know why many too didn't vote for you. That's fine. That's okay. Look who's still winning over here. That's fantastic. You know what? The people didn't vote for me. They didn't want me as an elected representative. I accepted that. I not keep running no 20 times. And that they did me a favor. Because look at me now, honey chill. Look at me now, living my best life. Better than the MPs. What? And I don't know if that was a typo of you making all them typos in one little, not even a full sentence. I mean, take your time. You're typing too fast and you're up in your feelings. Relax, Trisha. Relax yourself. And who's winning? No, I'm not winning thanks to Ween. I was a success before Ween Panton, during Ween Panton coming in the show, and after Ween Panton, because Ween Panton not investing in my show. That you need to go talk to Mario. He invested in Mario's show. Is Mario winning thanks to Ween Panton? I think not. So I guess Ween Panton money not really making people a success around. Yeah. Poor you. Y'all are so clueless. Big shout out to all of my amazing, wonderful clients who engage in my services and get them. Those are the ones that I'd like to take my hat off. And all of you, making us still the #1 talk show. I hear the Tower Marketing Report is out again. And guess who still has the #1 talk show, honey chow? I'm just saying. Drinking and sipping my water because the tea done finished. Look there. Teacup empty. All gone. Miss Stacy will be happy because most mornings she makes my tea and I don't even drink it. Lord Jehovah. Who's a convicted felon? Putting the PPM back in power would be like putting Trump back in the White House. Look at the mess it's creating. Well, I hate to tell you, Marshall, but the Trump equivalent, from what I'm hearing in this group, isn't the PPM. It's actually the CINP. They're the Trumpsters. Yikes. So I mean, they love them a Trump, apparently. Oh my God. Anyway, if only the rest who got voted out and now trying again could get the message that people don't want them. At least you are still offering some good after the fact, Sandy. Thank you, freedom of speech. I appreciate that. Yeah, you know, listen, if the people say they don't want you, no matter how good or qualified you are, respect the people's decision. That's what I did. So you'll be fine. I mean, if you got half a brain, you can still go out there and do something other than being a politician. You see, I wasn't trying to be a politician because I had nothing else to do and that because I was a failure, like Hunter said last night. No. I already had a business, was running a business. You know, it was in the early stages, the early years, I must admit. But, you know, y'all will be just fine. Oh my God. Okay. Anywho, what a hot mess. I better go and earn some money because, yeah, you know, Wayne Panton not paying my bills. So I better go earn it by doing other stuff. Mm-hmm. Work it, honey. Work it and twerk it. This one says, poor Trisha where the grass is. Try behave. You gone blurry again. Oh, Lord, have mercy. What's going on with the internet? Let me see. How bad is it? Oh, I know what to do. Hold on. I'm going to come up. Oh, you know what? I gone blurry as soon as I went on the VPN. Not true. I can't tell. I probably still have to refresh. Okay, hold on. Hold on. Oh, it's very blurry. I think it's a little bit better, but not much. Hold on. Okay. Any better, honey child? Let me see. Maybe it's just a bad internet day today. Oh, there it is. Whew, much better. All right, honey child. Hard to believe it's been 7 years already. By the way, today's dad's anniversary. Oh my God. Aw, I wish he was around to see CMR because I think he would have enjoyed it. Leon has one first cousin named Trisha. I wonder if that's her typing. You have a picture of her? If it's who I think it is, I can give you something to give her. Back it up. Something to give her. Oh my God. I don't know what that means. Oh, just got a quote from my little pepper jelly. Oh my God. So somebody's having to order jars from China because, you know, a lot of Caymanians are ordering stuff. With the 45% tariff, it now costs me more for just the jar than what I sell the finished packaged product for. So I'm discontinuing the popular little jars. Oh my God. Sad, really, but nothing I can do. On a separate note, what? Oh my God. Oh, I can't read that part. That's personal stuff. Oh my God. Oh, wow. That's messed up. Yeah, all these tariffs we're going to be feeling, honey child. It's a hot mess. Lord Jesus. All right, here is our final image of the day. This one came in. Let me find it. Hold on. Folks, get your dash cams. We still have some inventory. Where did I save that? Oh, yeah. I had to upgrade Miss Stacy's after that person hit her the other day and was trying to blame her for the accident. But I said the popo so slack. They were claiming we didn't have insurance. We showed them proof of insurance. We showed them the video footage from the accident, all that stuff. And all now, I hear one single word from them about, okay, they were only investigated because an expat calls 911 here renting a car. And I said, oh, you're investigating? Yeah, because it was a 911 call. I never got a copy of the report, and they didn't say nothing further in terms of an update. I'm like, really? Y'all ridiculous. Truly ridiculous. Anyway, all right. Beautiful, beautiful, beautiful. All right, I'm looking for 947. Who this is calling me? Oh, they hung up already. Okay, so I've got one of my house projects done. If you know what I've been working on, you know. If you don't know, then it's probably none of your business. I'm just kidding. I had a backyard project. Let me see who this is, 947 calling me. But it keeps hanging up. What the hell? Anyway, too bad for them. So anywho, yeah, so anyway, what was I going to tell y'all now? Yes. Hello? I'll call you back after the show. Where you sent it? On WhatsApp? Oh, okay. All right, cool. Okay. All right. Song requests. Okay, so hold on one second, y'all. Somebody said they needed a dash cam last night. Did y'all see the footage that I posted earlier? Of the person who bought one of the dash cams, and they're like, oh my God, Miss Sandy, I'm so glad that I did. Let me show you some of these, because this is proof positive that Cayman has some horrible drivers. Oh my God, y'all don't know how to drive. Not for nothing, but where did you buy your driver's license from? So let me show you these, because again, one was in a parking lot. This next one, school bus coming on through, and then people trying to just cut in and don't even know, sir. Y'all don't know how to drive. And the thing that this dash cam package, by the way, has the remote control in it. And what that means, folks, is that if something happens, you need to quickly take a picture of the person in front of you, which this person did. That was that last shot that you saw. You can actually take a picture of the vehicle. You can tell it because it had voice thing, but sometimes it's not going to understand our accent. So you just press that camera remote control and boom, it takes your picture. So hold on. Let me show y'all now. Hold on one second. I'm going to pull up the video footage. Oh, sorry. Okay, so this is the first one. Let me see here now. Bad driving, example number 1. So they're going into that plaza there, Cayman Business, what's it called? Cayman Business Center or something it's called? Business Park. Okay, so here they are driving through the parking lot. And it actually tells you, look now. They had to stop on the brakes because that person is actually coming out the wrong way. That's a one-way. So they were not even expecting them to be coming out. These are the kind of things, folks, that will cause accidents to happen. If you see an arrow going that way, you don't go that way. That's not how it works. One-way arrows are there for a reason. Here's another one now. This is up here, Newlands, Countryside area. You see Countryside there. They're going straight. Looks like 5 o'clock traffic. Yep, 5:51 p.m. Yes, and look, yeah, just pulling right in front of people, almost get hit. So they were good enough to snap a photo of this person jackass of the day yesterday, I'm sure. Let me show you, because it's easy to download all this stuff. The only thing is, I don't know if this person turned off there. You actually have, it'll tell you your miles per hour. It has a geo tracker location. So, you know, if somebody gets in an accident now and somebody else claims, well, the accidents happened down here. And you're like, no, it didn't. This particular camera has all that. That's why you're paying that top dollar for this camera. Okay, this camera, not no joke. This camera is the real deal. Okay, who is license plate number 130454? Driving a, what is that? A Toyota or Nissan? That looks like a Nissan. I'd have to enlarge the photo to see, but it looks like a Nissan. You can't drive like that. I mean, if you want to come over, you need somebody to give you a blind. You turn on your indicator. Sometimes I wave at people because they don't see you. Like, oh, can I come over? If they give you the A-OK, folks, that means you can come over. Until then, don't do it. Yes, Flight Simulator, long time ago, back in, oh God. Oh, well over, oh Lord, I'm trying to think now. How long ago that would have been? 20 years, 15, I don't know. It was a long time ago, but yes, I did. And that's when the PPM was really coming into their own about parties. And funny enough, their same MO, don't vote for independence. And I used to be a PPM member, but I resigned before that. All right, here is, I don't know, I don't think this is a local car, but anyway, it's still a good saying. You can't fix a broken system with the same people that broke it. Can we get a
Praise the Lord.
Yep, that's the truth. What's the guy's name to install the dash cams? Kevin. Yes, Carla. The remote controls are in town at the radio station at Stingray Radio. You need to go pick it up. Because after a while, they're going to call me and say, we still have all these remote controls. So please, if you don't have your remote control yet, go and collect it. I think I gave them one too many, though, because I have one here without a remote, so I might need to take one back. Somebody reminded me back in 2009. Y'all got a memory like a, I don't know what. All right. Very good. Thank you for reminding me. I just knew it was a long time ago. So yes, very good. And so I would have resigned from the PPM even before that. That shows you how long ago that was. All right. So yes, Kevin, if you need Kevin's number, just message me and I will send you the number again. He's been very, very busy taking care of most of you with the installations. All right. I think that's it. Good, folks. Hope that you guys have a beautiful Tuesday. Tomorrow, we're going to talk about the financial mess that this country is in and how we got here, overspending, basically. I told you guys this was going to happen, and you guys would not believe me. Well, here we are. Remember all you civil servants who were so happy to get that money? Oh, they're giving us a COLA. Oh, they're giving us another $2,000 for Christmas again. And remember France Manderson? France, they were lying to you, or you were confused. But remember, oh no, we had savings over here. And I tell you, you cannot have savings in one area of government if the entire government is broke. That's illogical. That makes zero sense. So we're going to break it down tomorrow because I told you all this was going to happen. And here we are. Now what's happening? Remember the civil servants? Y'all know who you are, Cindy? When I told you you accepting that money and post on Facebook about how happy you are? When the country broke, who do you think is going to pay for that? It's not just the civil service. It's going to be every single one of us. Next thing you know, they'll come tell you they can't afford the free lunches at school no more. Then what are you going to do? That little $2,000 she gave you that you pissed away on Christmas gifts and running to Miami or Jamaica or buying a new TV or whatever the hell y'all did with it, is it going to be worth it? Now that we broke and we're in a deficit and the FFR might come down on our friggin' necks? Next thing you know, the UK gonna come here and say, yep, y'all can't handle your own business. We take it over. Y'all better vote smart. And places like Georgetown West, Jesus Christ, where the pickings are small and you don't have much choice, vote for the person who's least likely to do the harm, the most amount of harm. And unfortunately, PPM, y'all doing the most amount of harm. Y'all need to go. Jesus. Good morning, honey child.
Good morning. How are you?
I'm very well. You got mangoes from Irwa? I'm asking everybody that question today. Hi. You got mangoes or plums?
Huh?
I don't hear nobody got plums anymore. Well,
yeah, but they're all green.
Oh, no. You got to wait till they're ripe for me. So when they're ripe, you call me.
All right.
What's on your mind, darling?
You was off island or what?
Just for the day and Friday. I just did a quick sneaky trip in and out.
No, but I've been calling you now for 2 weeks.
Oh, geez, I'm peace. No, sir. I've been here. But you know you're on air still, right? The show's still going.
Say that again.
You're on air because the show's still on. Did you want to be on air?
No.
Okay, so I can call you after the show.
Okay.
All right, my dear. He said he'd been calling me. What happens is, I know what's going on. What apparently happened is this is the show number. So when I walk away from the board, I walk away from the show number too. So if you're calling that number, you're probably not going to reach me for real. Just saying. All right. I think we're good. Tomorrow, Wednesday, Hump Day Wednesday. I'm going to go to the salon now. How do you like the plums? I like plums ripe, not overripe, but I like them ripe. But I love me some plums too, honey child. Lucky Body says, I guess Craig would be the best choice for Georgetown West. I really wish he had showed up last night. Oh, Jesus. Julie said they're in surplus at her carnival Saturday night in the Bronx. Well, she's a damn liar. Sorry, but she's a liar. That's a lie. All right, folks. Enjoy the rest of your day. I got a candidate interview to do later. Be good or be good at it, one of the two. And then I will see you guys tonight, the forum, 7 o'clock, 7:15, the last Georgetown district, which is Georgetown East. And then tomorrow is the Leaders Forum. By the way, let me just say this about the Leaders Forum. Some of you are confused because the Compass is doing some interesting advertising these days. And they have done an ad which makes it look like they're the ones hosting the candidate forum. Like I've had people message me say, oh, they have their own leaders forum. It's not. It's the same chamber forum, but they haven't carried any of the other forums, but they're going to carry that one. So they're advertising it in a way that has people confused. And you guys think that it's a separate forum, which it's not. So a little bit weird, but take it from me. Shady boots, honey child. Shady boots. It's not their forum. They obviously started their Compass TV a little bit late for election season, and they're still trying to pretend like there's some major player in it. Well, we only got a couple weeks left. Sorry, Compass, y'all came in late. But anyway, congrats to them. A lot of you are nostalgic about them recycling Cayman 27. When you have DART money, you can afford to waste over $1 million recycling something from 7 years ago. I don't want to say too much about them because I don't want to come off like I'm bitter or anything. You know, those of you who like the Compass, of course, you're going to like anything they throw at you. It is what it is. But I would be disappointed. I don't watch local TV, to be honest. I don't actually have any of the local providers. But I would be really, really disappointed that their formula is based on their business plan. You talk about, good, effective business plans. Their business plan is based on nostalgia, bringing back something y'all miss. And they have recreated it to a T. Even Daybreak, they couldn't even come up with a new name. For me, I'm like, what? Yeah, I would have been looking for something innovative. Even the formula of having one black person, one white person on the morning show, they've recreated that as well. It's just a little bit weird. But you know what? Y'all like it, you like it. I mean, I can't tell you what to like. But yeah, okay. They brought back pretty much all the staff. So Tammy's back over there, Mona Lisa, all the technical staff in the background. So although you do see some fresh faces, they've also retained a lot of those people on contract. I don't think they actually work for the station as an employee, but they've done like independent contract sort of thing. So they poached a lot of people from government, I heard. So they poached a lot of GIS people as well. And of course, I know that Donna, not for nothing, but Donna, that's where she's going to be going when she's not successful in the election. That's her plan, not even plan B. That's her plan A.1, because I'm pretty sure Donna knew she wasn't going to get elected with PPM. So I'm putting, who wants to bet me $1? No, bet me some brownies. I will make you brownies. Anybody wants to take on this bet that when Donna doesn't get in, she will be going to work at the station as well. All right. Anyway, see y'all tomorrow. Here's a couple commercials. Stay tuned for these.
For the first time ever in Cayman's political history, the Chamber Candidates Forum will feature a party leaders debate, and CMR is bringing it to you live. On Wednesday, April 9th at 7 p.m., tune in to hear directly from the leaders Andre Ebanks, Dan Scott, and Joey Hugh as they go head-to-head on the issues that matter most to you and the future of the Cayman Islands. This historic debate will be live-streamed on CMR TV's Facebook, YouTube, and Instagram channels. Don't miss this chance to stay informed, get engaged, and witness Cayman politics like never before.
It's time for fun, family, and community connection. On Saturday, April 12th, from 1 to 5 p.m., head to Windsor Park for an exciting family fun day hosted by Ulrich Lindsay, candidate for Georgetown South. Kids will enjoy games, laughter, and activities galore, while parents can take the opportunity to speak one-on-one with Ulrich. Share your thoughts and hear his vision for a stronger, smarter, and more resilient Georgetown South. It's all about bringing people together in a relaxed, family-friendly setting. Don't miss this chance to enjoy a fun-filled afternoon and get to know a candidate who's all about smart, hardworking, effective leadership. Come out and be part of the fun.
My name is Lauria Brenda Timothy, known to most people as Miss Brenda, and I am registered in West Bay North, and I'm proud to be registered in West Bay North to support Ralston Island. I've known Ralston all of his life, and better since he married my daughter, and he is an awesome dad to my 3 eldest granddaughters, Cheryl, Sharina, and Cherise. Well, I must say that Raleigh previously served as education minister, and I feel that he is the best. When he is elected again on April the 30th to serve us in Cayman Islands, I would like him to be the education minister again, because I feel that he done an excellent job, and I'm sure that when he is elected on April the 30th, he will go into the assembly prepared to do what is right for the people, and the people would be happy that they voted for him. So I'll urge people to really vote for him, because he's already proven himself. We could send Ralston to anywhere to represent us, and I feel like he would do a good job. We don't have to sit in our seats and be scared, oh, what's he going to say next? Or Is he going to say the right answer? Because I trust him, and I know I've proven him the way that he speaks. He's quite eloquent and well versed in conversation.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.